aging. So, as caregivers, as CNAs, before we even delve into what we want to do, we have that key, we have that responsibility, that's very, very serious and profound responsibility of working alongside these people with dementia, because you don't know where you would be. You don't actually know where you are actually going to be functioning, where they ask the particular departments that you will be working. But as a certified nursing assistant, of course, you cannot, you wouldn't miss the aspect of actually relating with these people, be it in your workplace or in your family or your neighborhood. So you get to see these people. So you have the responsibility of working with them, of working aside them, providing not just care for them, but compassion and understanding. Very important. Compassion, understanding. Do not judge them. Understand that they lived a life before now. Understand that it's just life that has happened to them. Understand that these were vibrant people. These were knowledgeable people. These were intelligent people. These were people that had their lives. They had their lives moving as you and I have. You know, but all of a sudden, due to some factors, life now relegated them to that background which they are. You understand? So when we deal with them, we should understand that we have to deal with them with compassion, with understanding. We are going to, in the course of this short time, we are going to have this dementia. We are going to explore the intricacies. We are going to look at everything that has got to do with dementia care, learning how to bring comfort, dignity, and to bring joy into the lives of these patients that actually have dementia. So without wasting time, let's just get to it. Let's get to what we have for today. Now, what is dementia? It's simply an umbrella term, but I want us to understand that there are different types of dementia. We have different types, of dementia. As you can see here, we have different types, and the names align with the way and manner with which that person is feeling the symptoms or having the symptoms. Now, dementia has got to do with loss of memory, thinking abilities, not just on the surface. I remember some time ago, someone asked me this question in one of the trainings and said, please, that I have a friend that she took her house key to the supermarket. She's a young lady of maybe in her late 20s. She took her house key to the supermarket to get some things to shop, and she forgot the key there. She's done it like once or twice. I mean, I beg your pardon. She's done it like twice now. So please, madam, she asked me on one of these trainings, is she having dementia? And I laughed. The reason I laughed is because it was somewhat funny. I had to laugh. Now, I had to explain to her that dementia is not just, we forget from time to time. Once in a while, you forget somebody like me. I don't carry my car key around because I know I have my purse, because any little mistake, I'll drop it somewhere and I'll forget. It's been like that for a long time with me. So I cannot attribute it to dementia. Now, but dementia must be serious enough to affect you in terms of you will have persistent, take note of that word, persistent. You have persistent loss of memory loss. You would have your thinking abilities distorted seriously enough to interfere with your daily life. It's not just the one you forget. Oh, I was supposed to pick something up by this time. Oh, I forgot. Oh, I was supposed to send something to Madam Promise. I forgot. No, not just those ones. It has to be severe enough to distort your daily life, to interfere with how you live your life. That is dementia. So dementia, like we already have here, is an umbrella term. Hence, you've seen the beautiful umbrella that is there. So we have types of dementia. And in all these types of dementia, the one that is most common is the Alzheimer's disease. That one, we have the highest. If you say dementia 100%, we have, I think, about 60 or more percentage of people have Alzheimer's disease. It's a form of dementia that is quite common. And is the most common type of dementia. It affects the memory, it affects thinking, it affects behavior, and it comes with its own signs. You get to see some signs: forgetfulness, confusion about the time. Sometimes people that have Alzheimer's disease, they get confused. In fact, time, they don't know time, they don't have a good record of time and how time moves, or knowing that, oh, this thing happened this time, or this one happened that time. No, hence, they're not able to actually coordinate the activities in their life. Some things that happened when they were young, they can take it that it happened when they were old, and there's a little bit of a humble jumble, when they do these things. So that is Alzheimer's disease. And with it, difficulty too with tasks that were familiar tasks that they could actually do. So the Alzheimer's disease is the most common form of dementia, and is most times linked to the buildup of proteins, like we talked about anatomy and physiology the other time. When you have protein build up in your brain, in the brain, when protein builds up in the brain, it disrupts, it stays as a blockage. It blocks your nervous system, it blocks a whole lot of things. So as such, it translates into your communication. It affects your brain cells. And when it does, of course, the brain coordinates everything. Communication is coordinated by the brain. So that is Alzheimer's disease. We have vascular dementia too, which is the second in hierarchy, is the second form of dementia that results from stroke or maybe other conditions, that affects blood flow to the brain. Obviously, we know that stroke is one thing that affects blood flow to the brain. When there is a blockage in the blood, how it flows in the brain, it results to one part of your body being paralysis. So that's hence what results is stroke. So this vascular dementia comes from maybe strokes, or any condition that has got to do with the brain that affects the blood flow to the brain. And the symptoms can vary widely. It can vary, including problems with maybe planning, being able to organize things, difficulty with attention, and memory issues too, being able to remember, and a whole lot. And it tends to progress in a stepwise manner. It suddenly declines. If someone has vascular dementia now, with time, as you keep going, so the symptoms worsen. That's what happens. So we also have the other types. We have the Lewy body 2 dementia. That one too, abnormal protein deposits in the brain, also causes this type of dementia. We have the frontotemporal too. All this are different types of dementia that you just need to know in the passing. I just feel you should know, you understand. But as CNAs, you don't really have to, except you want to become, as you progress, you become registered nurses and specialize, maybe you become a dementia, because there is an area of specialty that you can specialize if you want to. As a certified nursing assistant, you can be a dementia care nurse assistant. That one, when it comes to these elderly people with their issues, you are set in that particular department because you have the right knowledge to handle them. Because I must tell you, it's not easy. It's not a walk in the park, like I like to say. It's not easy. So it needs some area of, it needs some specialty, some specialization in it. But hence, it's just important that you know that there are different types of dementia. Like we have here, we have others too, Huntington's disease. We also have mixed dementia, whereby maybe dementia from more than one cause, different causes. So overall, dementia is an illness that affects the memory. That's the bottom line, affects your thinking, interferes with your daily life, and a whole lot of things. That is dementia. So it's important that we know these things because we are going to be interfacing with people that have this challenge. So you have to take it easy with them. You have to follow them with understanding. You have to follow them with a compassion. You don't have to be too in short, not too. I don't even need to use the word too. You don't have to be hard on them. Let me just use that word. You don't have to be hard on them, because the truth of the matter is what they are actually going through is much. So you don't have to add anything. You follow them with understanding. You talk to them. Sometimes when they do things that ordinarily you'll be like, God, is this person, what is the, But if you understand the pros and the cons of this dementia and dementia care to make it easier for you to handle them when you see these things. You can look at this particular slide, see a whole lot of things going on, memory, perception, it interferes with your ability to, to be able to perceive things. Perception, how do you see this? You may not be able to coordinate. Your sense of reasoning, your attention, your concentration, your sense of judgment. Is it yes or no? How should this thing be? Is it supposed to be like this? Oh no, it's supposed to be like that. You cannot make any decision. And most times too, it affects the language depending on the stage that it is. So at this point now, I want to quickly, before we move to this stages of dementia. Now, I want to just give you a short illustration, a very short one, because I like to give illustrations. I don't know if I have, if everyone can hear me. I don't know if everybody can hear me. Are we together?
We are together, ma.
Yes,
Okay.
ma.
All right.
Yes, ma. Yes, ma.
So I want to, okay, thank you. I want to give you a scenario that happened to me. That's why what I'm telling you is for you to understand the importance of knowledge. So many people would be like, oh, I am paying money to take a training. I want to be a certified nursing assistant. Or I've had people that say, oh, I don't really even want to be the certified nursing assistant, but is it really important? And I just smile because no knowledge is wasted. The knowledge you have, you can use it in your life. You can use it with your neighbors. Most of us have elderly people. We have elderly parents, and we will equally age. Some of us, we would have take care of our husbands, maybe that will age, maybe older than us, or we have people around. So when you have this knowledge, it doesn't mean that you have to be in the moon or in the sun to actually practice as a certified nursing assistant. No, you can still use this knowledge in your day-to-day life. Now, some years ago, I have this friend where when I started working earlier on in life, I have this friend that young, fresh from the university, we had to work after this service. We're given this job, we had to work, and maybe that was my very first time to actually see one-on-one, to have a true life experience of what I am teaching you today. So this, my friend, her mother was not well. Her mother has been sick for a long time, and she took her mother, you know how female children can be. She took her mother from the brothers, and she decided to take care of her mother. She said, oh, she would want her mother to live with her. So her mother actually came and lived with her, but the state with which the mother was, we didn't understand. What we only knew was that every time Uwem, that was her name, every time Uwem would want to go home, in between her breaks, she would want to leave the school, to pack. She packs her car outside. She does not even pack it inside because she wants to leave the school. And we that were closer to her, we know that she's always leaving the school from time to time to go to the house. And we didn't understand, they say he who feels it knows it, really. So we couldn't understand what was going on with her. She understood. She alone understood what she was actually going through. So she will go home. She'll say, oh, I'm coming. I need to just rush home. So that fateful day when we closed from work, I wanted to follow her to the house, so I joined her. And we got home. When we got home, that was my first time of actually seeing her mother. When we got home, we opened the door, we entered the house. I mean, a job that we've worked for, I think 5 years, 4 or 5 years counting, as at that time I went to her house. So it's not a job she just had. So when we went to the house, she was sitting there, she just sat down, and I entered, I greeted her, and she didn't say a word. She just looked at me, and normally I just said maybe she's not fine. Already we knew she was not fine, so I left it. But what came out of her mouth shocked me to my bone marrow. That's when I first experienced the impact of dementia. What came out of her mouth? She was like, oh, she called the daughter. That was a good day according to the daughter, because most times she doesn't remember the daughter's name. So she called on the daughter and she said, oh, you're welcome. I know it's been a hectic day. Each day you take your file and go and look for jobs. Like she said it in our local dialect. You pick up your file and go and look for job. Oh, my daughter, have you finally gotten the job? How was the interview today? Did you get the job? Are you going to start work soon? And the daughter, maybe out of embarrassment, I want to believe so, these things now, She was like, oh, this my mother, see how she embarrassed me in front of a visitor. I want to believe that's how she felt. But before I knew what was happening, she busted into tears. She was just standing there with me. She busted into tears. And I just took in the scenario. I took it instantly because I'm very fast. I just took it instantly and I understood what the challenge was, even though then I didn't know anything about dementia, to be very candid. I didn't, So later I had to take her to the dining and then we sat down. I told her, why are you crying? What's the problem? She says, see what has happened. See my mother. See, my mother cannot even know that I have started working over 5 years. Now, how can my mommy ask me if I have a comeback, if I was given the job? I mean, a job that I've been working 5 years counting now. How can my mom that she does this thing? Sometimes she will not remember my name. She breaks my heart. She will not remember my name and all that. It was, I mean, if you can just understand what I'm trying to say, it was very sad. It was a sad situation, and I began to... Please, can we mute our mics? Can we just do the needful, please? Let's mute our mics, please, so we can move. So practically, why did I tell you that story? Sometimes these things can be frustrating when you have them. But it will be easier if you understand. As at that time, my friend didn't know anything. She didn't know anything about that. She didn't know what was dementia. She was like, in fact, according to her, when it started, she was like, her mother was just being funny. She was just seeking attention and all those things. So she didn't even take it serious until she knew that for my mother to forget my name, even when I give her money, if anything, my mother cannot forget who gives her money. But for her to forget that I gave her money, then I know that it's not a prank anymore. It's a serious business. So what am I saying? These things happen, and dementia is in stages. We have the first stage, we have the second stage, we have the third stage of dementia. So regardless of the stage of the dementia, what we should understand is that all of the symptoms are mostly interwoven. They look alike, the symptoms of the different stages. It's just that the higher the stage, the more serious the system would. I mean, the symptoms metamorphose. Madam Awosonya, please kindly help us, please. Then I have said you should mute your mic. Just help us so we can move. Thank you so much, madam. So, we were actually talking about the first stage. So now the first stage of dementia comes with a whole lot of things. We have the mild memory loss. It starts with the mild memory loss. Maybe they'll begin to forget things. Take, for instance, maybe I used to have one retired accountant that lived near us who has been very meticulous. I hope you know accountants, how meticulous they can be, but lately, he finds himself, this particular man, forgetting appointments or misplacing his glasses. Sometimes he wants to go out and he will misplace his glasses. He cannot even coordinate or remember where the glasses, he kept it. So one day he couldn't even recall where he parked his car. He went to get groceries and he couldn't recall where he parked his car, leading to frustration and confusion. He was looking for where he parked his car. So these are some of the things that come with the first stage. At that point, he could even drive his car, he could even park it and all that. So you know that he's still in the mild stage. It has not degenerated onto stage 2 and stage 3. Now, difficulty 2 with familiar tasks. Another thing that comes in, while preparing maybe meals, you begin to forget how much sugar you should add. Some things that you've done over and over and over again, countless times, you begin to forget. Sometimes you have moments, these patients have moments of uncertainty, that unsettles them. They feel embarrassed. Sometimes asking for help, that's one thing, that early stage. Sometimes when they actually forget these things, it's one of the things that come with that first stage. They become embarrassed because actually it's embarrassing, to say, oh, please, can you just tell me how many cups of sugar am I supposed to put in this thing? Or where did I keep my glasses? Or all those forms of things that, especially when it is monotonous, when it keep coming, they're embarrassed to ask because they feel that the children or the people around will be thinking that there's something wrong with them. Of course, you know, they don't always like people thinking there's something wrong with them. So this is important. Difficulty with familiar tasks. They begin to struggle with with things that ordinarily they used to do. Now, another thing is struggling with language too. You know, sometimes when they talk, people that have dementia patients, when they talk, they find it very difficult to complete sentences. Sometimes they pause in between, in the middle of sentences, unable to find maybe the right word to use, you know, maybe the right word to use or to pronounce the words well. They begin to have some, you know, mumble jumble along the way, you know. So these things are actually happened. And you know, when people see these things, when you know it's that first stage, in order not to embarrass them, you don't just say, oh, but you were supposed to know. Why are you asking? This is funny. You've been behaving like this, or you don't help to cause more embarrassment in that state that they are. Hence the knowledge, because some people may be seeing such a thing. For instance, maybe trying to form a particular word, person is not able to, or maybe forgetting something, and you've seen the age, you know that this person has been struggling with some of these issues. In order not to make them feel more embarrassed, you don't bring it out. If it's in a gathering or anything, to say, why should you forget? Or maybe as that my friend, maybe to say, oh, mommy, why are you saying this? Why are you actually asking me if I'm just getting the job? Now, have you forgotten that I got the job 5 years ago? Why are you asking me now and all that? It could be embarrassing. So we are going to learn some of the techniques, some things, the escalating techniques, some of the redirecting techniques that you can actually help to direct this thing, you know, and the conversations too. So we also have disorientation to time and place. Like I said already, these people with this challenge, they don't know how to coordinate time. Just like that one I gave you an illustration about. You know, they don't know how to put together time, like to really know when is this or when is this supposed to be done. Like, let's take, for instance, maybe a person, you know, that steps out for a walk, but can't recall if it's morning or if it's even afternoon, you know, he's unsure, he or she is unsure if he should be heading to lunch or it should be dinner or it should be breakfast. They don't even know. And this form of disorientation can lead to anxiety, you know, and he can just feel lost. He can just feel lost. He can feel something is wrong, especially at this initial point, first stage. It can be very frustrating because you begin to ask yourself, what is actually wrong with me? You know, what is actually wrong with me? They may not ask you, but they are trying to ask themselves, what is going on? What's happening to me? I cannot, you know, they ask themselves a lot of questions. And at this point too, they live in disbelief. Like they don't believe that there's something wrong. Even though they are having that mindset that there's something wrong, they still are trying to, you know, like say it is well, that syndrome of it is well. And maybe nothing is actually happening and all that. They are still struggling, you know, to be conscious of what is actually happening. Changes in their mood and personality is also important. People that used to be the life, like I know my grandmother used to be the life of any party then, you know, in those days, you know, she used to be the life of any party. Anywhere she enters, she lights up the room. That is the kind of grandmother that I had. At least, even though I wasn't born that time in her heydays, I got to hear how she was, you know, she lights up the room. But when it goes to that stage, she began to withdraw from large gatherings. Anything that involves her to go where people are, my grandma will never go. You know, feeling more comfortable in her familiar surroundings, anywhere that is unfamiliar. She prefers to be within the confines of her home. The things, the pictures that she loves to see in the sitting room, the people that are always around her, the bed, you know, the familiarity of her environment. She doesn't like to leave. You know, so such things, when you see those signs, you understand that something has set in. That's the first stage. You see those, her friends begin to notice the change in her attitude, you know, but they don't realize it's an early sign of dementia. So you see that even in the midst of that, when you sense these things, it is important that you check, that you find out what is actually the challenge. What is the problem? You need to find out what is actually the problem, what is eating that person up, what is making that person withdrawn. You have to find out, because until you actually go to the hospital and follow through the clinical aspect of it, You cannot 100% say that a person has dementia, but if you know the symptoms and you know the signs, it will give you much cause for concern that you would reach out. You know that something has to be done, you know, when you see these signs. Hence, it is important. And if you are in a hospital, of course, you have the person's care plan. You will have everything about the person. And because, like I said, a certified nursing assistant, you have first-hand information as to what happens with the patient, because on daily basis, you interface with the patient. So you should be able to state how that patient is actually doing, or the signs and symptoms that you are seeing. These things are very, very important. So we've looked at that. And it's important that we know how to handle these people. You know how to look at them. Then we are moving to the second stage of dementia. But I don't know if, like I like to do, never mind, we would have time for questions. For those joining us today, you may not know the pattern with which we operate. You can put your questions in the chat box while I am talking. Put your questions in the chat box, but I always give time for contributions. I always give time for everyone to share, because I know we have experiences here. Over time, when I take these trainings, I have to even try to see how to cut it, because I have series of people sharing their experiences, which helps us to learn, helps me to learn as well, because nobody is an embodiment of knowledge. So it helps me to learn too over the years from knowledgeable professionals as you. So if you have anything to share, you have a question, put it in the chat box, and then we can share it together. We can rub minds, and then we can hear. So right now, we are moving to the moderate stage. I want us to look at the 3 stages. Then you ask maybe your questions before we move to the next slide. Okay, so cognitive decline continues. Cognitive decline. Anything that has got to do with thinking, anything that has got to do with your ability to understand, to put together things, to make informed decisions, you know, and so on, is cognitive. It has to do with your brain. It has to do with your sense of reasoning. So with the second stage, this particular challenge, your memory, your ability to retain things, to remember things deteriorates. Remember, I told you that the symptoms are alike in the 3 stages, but as you progress in the stages, it becomes more intense. It deteriorates, you know, it worsens. That's the word. As you move to second stage, it worsens. As you move to third, of course, we know that. You understand? So, second stage, the person's cognitive ability deteriorates, and the person gets more confused. Confusion sets in, and the confusion is pronounced. Remember, the first one is just a little 1 or 2 mistakes, you know. But this one, the confusion is more pronounced. People begin to see it more, that all is not well. Something. Okay, someone is asking if early dementia can be corrected. Just like any other illness, like cancer, like any other thing, early detection can go a long way in helping. That's why regular checkups, Chima, is very important. Regular checkups, go to the hospital, check yourself. When you sense you have an aged mother, you have someone around you that you begin to observe all these things, forgetfulness, this is, as soon as you see it, there are signs. That's why medical checkup is important. You cannot 100% deduce or be sure that a person is having dementia until appropriate checks. You have to take the person to the hospital, and then they check to confirm if the person, we have things that we can use in actually checking in the hospital. Practitioners, they check, they go through, and if the person has dementia, then the earlier the better. They can start to see how to help with strategies that could be put in place to help that person, you know. But if it is not detected early, because most times people take for granted their health, they are not concerned, like they just wave it away. When they see these signs, they just take it to be maybe tiredness or maybe something, you know, as we are, especially over here in the world. Yeah, that's correct. Promise, beautiful. I'm happy I have people that are thinking fast. Yes, most times, to a large extent, is genetical. To a large extent, is genetical. If your parents had dementia, the chances that you practitioners will tell you the chances is high. It's in fact, in 60% cases has got to do with genetics. It's a trend in the family. But nevertheless, someone having dementia is not a death sentence. Like I tell people, it's not. It's just for you to know how to handle that person, and then early detection. Immediately it is detected, something is done about it before it worsens. So confusion, restlessness during the evening hours, you find out that these people get restless. That is called sundowning. That's what it is called. That's the name. Sundowning is a sign, or is something that is attributed to dementia patients. It happens to them. It's this kind of confusion and restlessness that comes to them in the evening, during the evening hours when the sun is down. That's why it's called sundowning. You see, they begin to exhibit some kind of restlessness. They begin to become confused. They become busy doing nothing. Let me use that word, busy. You don't see what they are doing. They are so restless. They are so agitated. That is that sundowning, So also, inability for them to be able to use objects such as spoon, memory loss, they cannot recall, little retention, and signs of hallucinations coming too. They begin to think it can even be that there is nothing on this table. They didn't keep anything, but you see how they could get very angry that someone has stolen this thing. Someone stole, someone, and so on and so forth. So these things, hallucinations, or they've seen something here, or they've seen something around them, and it's actually nothing. So when you know these things and you see these signs, you understand that you have to take it easy on them. Not, why are you? Who told you that thing was there? That's the worst thing that can ever happen, for you to argue with a person that is having dementia. Is the worst thing. We are going to see ways that we can handle some of these things, because your arguing cannot help. If they say, I kept this thing here and it disappeared, and you are busy there, talking, maybe shouting in some cases, for those of us that don't really know how to handle it, we are shouting and showing our normal attitude, maybe with our grandparents, and so I say, why did you say grandma? Or nobody took that. There was nothing on that bed. I don't know why you are saying there was no, you are just wasting your time. So hence we are going to learn we're going to learn de-escalation techniques. We are going to learn the redirecting techniques. Those things that you can do. We are going to see strategies that can help us to handle these challenges when we see them as CNAs, certified nursing assistants. We can handle it, whether in our environment or whether at work. So we are going to, at this point, look at the last stage of dementia. But this last stage of dementia, like people know, I don't like doing talking all through. So I would like to let us view this together, and then we'll learn one or two things from this particular. We've talked about the first stage, we've talked about the second stage, and now the third stage, which is the first stage is always called the mild stage. The second stage is always called the moderate stage. And we are going to look at the last stage. I don't want to tell you the name so that you can look at it and see the name when we get to that slide. But that having said, I don't know if we are together. Please, are you able to get anything from what I have said so far, or have I been in any way talking to myself?
No, I'm getting it.
You're talking to us, Ma. We are getting it.
All right. So maybe before we watch the video, I would like to ask, do we have any experience? Who would like to share an experience with us? Experience you have had, and maybe you would like to share from a loved one, and maybe you can tell us some of the things you experienced and what did you really do? Having experienced that, who is going to set the ball rolling? I've been hearing experience anytime I get to this dementia care. And I don't want to monopolize the training. I don't like monopolizing sessions when I do my training. So I want to hear you. Time is for me to drink water and relax and just hear you. So Flourish, you wanted to start? The ball is...
Yeah, let me start, Ma.
Go ahead, Flourish. I love to
Good
hear
evening,
that
everyone.
voice. Good evening, Flourish.
Good evening, everyone. Good evening, Doctor. I had an experience with my aunt, my mom, elder sister. And just now, it just occurred to me that then they were saying maybe she did some certain evil, maybe she offended people that made her to be saying words that is not supposed to be saying. She will just go out, pull her slippers, forget her purse. They will not be calling my mom, but they say your sister. Oh, my mom will say, what kind of issue is this? Which kind of mental illness is this? The children, they even took her to psychiatric hospital in Benin. They were like,
so bad.
They went so bad that they started holding her at home. They will not give her food so that she will not leave the house. But if she immediately sneak out, at least 2-3 days we'll be looking for her. My mom will be restless. Everybody will be restless. Now that you are talking about dementia, and that made me to know that what she was passing through at that time was dementia. Not that she did anything evil. She will start saying things that she's seeing ghosts of her forefathers that she does not even know. Everybody was scared.
Please don't let me laugh, please.
Everybody was scared. But right now, I understand that it's dementia. Even the senior son died last year, 70-something. She died at 90-something. But before the senior son died, he was still saying such thing. He would just park his motor and use his leg and say they stole his car. We'll start announcing. We'll not find out that he went somewhere and parked his car. So that was why I was asking if it's an hereditary sickness before I now stop promising saying it. Thank you.
Yeah, when I saw it too, I knew that people have a lot to say. Thank you, Flourish. That's a beautiful one. So you see that, let nobody deceive you. I know that there are many people that would have needed this knowledge and maybe needed this training so far. They have been they were like a bit worried and saying, let me, Nigerian syndrome, maybe these people run away with them. Oh, these people are this and these people are that. Truly speaking, to be very candid, we have a lot to gain from this, because you get to learn. If no knowledge is wasted, take for instance, then you people knew what to do. You would have channeled, not to take her to a psychiatric hospital, but you would have at first observed the signs, and then before it degenerated to that point, maybe you would have been able to see it and nip it in the bud before it gets to that stage. So thank you, Flourish. It's good to have the right knowledge, because there's a very thin line between life and death, I tell people. And just that knowledge could be the difference between the two. Just that slight knowledge that you don't have at the right time that you should have could be the difference between the life and the death. So thank you, Flourish. That's a beautiful one. You made me laugh a little bit, and that's what I like. Thank you. Okay, I saw Blessing's hand. Blessing, please. You wanted to share your experience with us? Yes, Blessing, go ahead. Thank you.
Okay, good evening, everyone. Just a quick one. I had similar experience with my grandfather before he died. That was quite young then, but I noticed that my elder sister was the one taking care of him, and I noticed that each time we leave him alone and he goes out, he finds it difficult to, find his way back. Someone has to call us.
That's right.
to come and see your grandfather is here, or someone will bring him back home. So I was wondering, what's wrong with grandpa? What's wrong with grandpa? So, but this session today has really enlightened me. Thank you.
All right, Blessing. It's nice to hear your voice. You see this beautiful voice that I missed all through this week, all through since we started. Yeah, but no problem. I'm sure you will make it up to us and to me. Thank you, Blessing, for that, for sharing that. So you see, we see these things. So sometimes it can be like drama. If you know how drama is, it can be like a movie. And if you don't have the right knowledge, you would just be, you think your mind, our Nigerian syndrome, your mind will travel places and go different aspects. And, we don't waste time to attribute something to maybe witchcraft or, so before you know, you say, I got the person, the person is a witch, this is my grandmother, oh my God, it's all her atrocities that has come to haunt her, and a whole lot. We get to see these things. That's why knowledge is important. Thank you so much. Okay, I saw Miranda's hand. Miranda, did you want to share something with us? Go ahead, please.
No, Ma.
You are just enjoying.
I'm just enjoying the storytelling, yeah.
Okay. All right. Okay, what are the right measures to prevent dementia? Okay, promise we'll get to that shortly. Let me not preempt what we wanted to do. Yes, blessing. We have 2 blessings here. So I'm going to be using the surname Blessing John Holt. I think so. Blessing, I saw your hand. Is she still here? Because I've been looking for Blessing and I just saw the Blessing. I don't know what happened. Okay.
I'm here, ma. But
Hi.
I didn't raise my hands. Good evening, ma'am.
Okay. Good evening, Blessing. You see this your beautiful voice that I have missed. In fact, during the weekend, I said, Blessing, what happened? It was one of the first day, in fact, paying, and she paid the money in full, you know. Why? You were one of the first when we didn't even bring out the schedule for this training. You had so much trust in us. We weren't even scared that I will run away with that your money this Christmas time to purchase things, you know. So I was wondering, I said, is it that I didn't add her to the group? What's happening? Blessing has not been joining us. So
Yeah,
I'm so glad.
I've been busy. You know, I told you my kind of work. So
yeah, you did.
I've always been the meeting, but not not get fully involved. Yeah, yes,
it's fine. It's fine, no problem. So thank you for trusting us, to have had that trust in us, you know. Others would say, I know so many others will say, oh, let me just pay the first installment of 40,000 and see if this thing will really work. At least just like a chicken that will step in with one leg. Let me step in with this one leg first so that let me see if these people are real, but it's fine. You know, that's the world is like that. The bad people really
of the
So you are confessing now that you are part of the other. Okay.
I hide my own. Now
True
just
confession.
I was part of it.
All right, don't worry. I've got your back. Everybody that takes training with us, you know, we've got your back anytime, any day. So don't worry. The people that are still thinking whether it's real or not, they will get to hear us at the end of the day. So thank you for trusting us, everybody. So who wanted to say something? Blessing said she didn't have anything. I guess I saw Mr. Matthew's hand. Mr. Matthew, did I see your hand raised? Mr. Matthew, are we good? Okay, it's like
hello,
I cannot.
Ma. I didn't raise my hand.
Okay, all right, thank you. Mildred, yes, I was wondering if you were not here because Mildred, I'm even thinking of employing you because I think you are almost getting better than me in relating experiences and telling us, you know, keeping us abreast with what is going on. So the floor is yours, Mildred, please.
Good evening, doctor.
Good evening, Mildred.
Okay, talking about dementia, I have known about dementia for years because, in fact, the most recent one, my mom's eldest sister, who passed away in November,
I'm so sorry.
We laid out to rest in January this year. You know, her son visited her. After visiting her for 2 weeks after, he went back to visit her again because she lives in Benin and her son is in Lagos. So she was with her in her daughter's house, you know. So she couldn't recognize her son. So the son was talking to her. She could not recognize him. Say, "Who are you? I don't know you." In our language, "I don't know you. Who are you?" So her son started crying, her eldest son. So before the son came, suddenly, if the daughter comes back from her office, she'll be telling her daughter that all the people that have died, even including my mom. She said my mom just left her. And my mom came to see her. I just left. I even auntie, this one came, you know, like that. So when her daughter called me, she was crying. She said she doesn't understand her mother again. I said it's dementia now. That she's old. That age 80-something that is common, is rampant among that's her age. That is dementia, she's loss of memory loss. That's what is happening to her. That is not a big deal that she just try and manage her. That she even rejecting food. I said, yes, you have to pamper her now. then make that every type of food. Let her, maybe she'll be able to choose one by herself. And when she makes that kind of, she'll make pap, make this, make that, then she will now point the one she will like to want to eat. So she will call me and say, oh, that suggestion worked. So I say, yes, that's what you'll be doing. If not, she will not eat anything. So that was how they were able to manage her until she now passed away. After like 8 months, she had the dementia and she passed away. And I had another uncle. He will tell you that he's just coming back from the UK. That in fact, if a flight is waiting for him, he's going to the US. So it's also, when they now discovered, took him to the hospital, especially to somewhere in Delta. They now diagnosed that he was having dementia, memory loss, because he doesn't even relate again about Nigeria. He's always talking about abroad and how he sees his friends and all that. So they also diagnosed that was dementia. And he's still alive. They're still managing him. Thank you, ma'am. Hello? Hello?
Hello, we can hear you.
Okay, I'm done. I think there's, I don't know. I'm done. Thank you.
Doctor, you want to drink water?
Okay.
Hello.
I'm not sure she's online. I think she's having network.
She said she wants to go and drink water.
Oh, okay.
Doctor.
Somebody be a doctor now. 1 minute, doctor.
Maybe it's our network.
Mildred, be our doctor. Give us more.
Hey,
I think network lock her out.
Like
It's our network.
Dr.
Network is
Mildred.
really fluctuating.
Dr. Mildred. Mildred.
I'm
Be
a
our
student. I'm a
doctor.
student. I'm a student. I'm a student.
We want to
I'm a
learn
student.
from you. Student, do lecture student. We are continuing.
Well, dementia is common now, but usually those that are over like 70, like that, it's very rare for 50 something. I think 60 something. It's very common now, because if you go to most care homes in Nigeria, at least I know two in Abuja, so you see elderly men and women brought in by their family members. Their only problem is not that they are really, it's dementia, because they can't remember anything again, and nobody can take care of them in the house, so they bring them to care homes. In fact, even abroad, the most 80, when you see them bringing in 78, 75 years, their illness is dementia, loss of memory. It's very common among whites, So most of the care homes abroad, UK, US, all the elderly people you see there, I can tell you that 80% is dementia cases. Not that they are busy like sick, dementia, loss of memory. And it happens to them because, they are kind of life there. Because when they get married, they live with their wife for years, for like 20, 30, 40, 50 years. So when one passes away, it's always difficult for the other one to remain the same, So it affects them a lot when their loved one, maybe the husband, the whole wife, I'm not talking about Nigeria, where it also happened by my auntie, one of my very, very far, not very immediate auntie anyway, like just like family members from the same hometown. When her husband passed away, in fact, she had dementia, less than 6 months, because the thought of losing her husband, the feelings and all that, she couldn't stay alone. She couldn't stay without her husband, and he had loss of memory. So that's it basically. But it's very, very common now among very elderly people. I have not really seen any young person that have had dementia. Because as at that point, I think Dr. Dorothy will explain better. Because when I ask questions, there are some things they explain to me why it happens. Because then their immune system is weak, especially the brain. So that's what happens. So if she come, I think she will go there and she will lecture us deeper than what I was told. So I'm still a student. So let's wait and see. Let her come back and continue. Thank you.
Thank you,
Okay.
ma.
Mildred,
Thank you,
thank you. Do
Mildred.
you know what happened to
Thank
me?
you so much.
Network locked me out. Did you observe? Did anybody observe? Because I was still hearing you talk when I came back.
Yes, now.
Yes,
All of us.
Really? And I was trying to hide it so nobody would observe. Wow. Okay. Network locked me out when you were talking. I had to now start logging in all over again. And I
But
was...
we actually told me your doctor.
Pardon? I didn't hear you. What did you say?
We thought you went to drink water.
because because I'm a water person. Okay.
No, we noticed you are not available, so we told you.
Thank you. See why I say you are wonderful. In fact, I am in love with this set. I'm in love with this set. When I came back, it was as if I never left because Mildred was still, was still talking. So thank you, everybody. Network just wanted to be funny, but we thank God I am back. So Mildred, even though I didn't hear half of what you said, because network did not permit me to hear. But let's do what we have to do. Back to where we stopped. Good. Okay, so we were talking about Mildred. Sorry, I couldn't hear what you said, but I know you were trying to give me your own illustration of how the experience you had with dementia, with your family, I think your aunt, you said. Okay, so do we have any other contribution? Do we have any other contribution? Okay, let's just take a look at this video. Like I like to do, this video is talking about the last stage of dementia. So you see a couple of things and you learn a couple of things. So let's get there. Okay, so let's get there and see. Please, I'll need to know if you are able to hear as usual. We are going to learn one or two things from what happens in the last stage of dementia, what to do and what happens. Okay.
Hello. Hey. No, I'm at work. Nothing. She's in bed. Nope.
Okay, please, what's the feedback like? Can we hear? Is it clear enough? And volume? Is it audible?
Yes, it's audible. I can hear you.
Yes, we can hear
Yeah,
her, but I
like
think
the
it's not audible here. It's not that audible here.
It's audible here.
Okay, let me just take the highest
She
volume.
muted it.
Let's begin. Okay. All right.
Hello. Hey. No, I'm at work. Nothing. She's in bed. Nope. Just hanging. Reading a gardening magazine because I forgot my Kindle. Oh my God. Holy cow. I know all about geraniums now. Yeah. I don't know. Maybe later. I don't really have to do much cooking anymore, so. Yeah, okay. Well, I'll just call you later then. Perfect. Sounds good. All right, bye-bye. Late-stage dementia is severe memory loss where only fragments of memory remain. A client in late-stage dementia may lose the ability to speak, walk, and eat. This stage usually lasts a couple of years and will end in the older adult's eventual death. The needs of a client living with late-stage dementia will change and become more intense and demanding. They may have trouble eating and swallowing. They might need help walking or become incapable of walking altogether. Your client may need assistance with personal grooming, toileting, and other personal care, and they'll be more prone to infection, particularly pneumonia. When your client has late-stage dementia, your goal is to maintain dignity and quality of life. Research has shown that although your client will lose the ability to communicate, some essence of the person is still there and you can connect with them. But without speech, they'll be more dependent on the other senses to interact with you and the world. So you can provide care through touch, sound, sight, taste, and smell. You can cook their favorite meals, play the music they love, read from books or magazines they enjoy, or look through family photo albums with them. Spend quiet time applying lotion or brushing their hair, or just sit outside in the fresh air. Older adults with dementia become nonverbal as the loss of brain cells impacts the speaking part of the brain. Repetitive behaviors increase, and depression and anxiety are more common. Joan, it's Liz. Always approach the older adult from the front and identify yourself. Irritability can increase. Don't take this personally as it reflects a disease, not the person. Sleep changes are common, like sleeping during the day and being awake at night. Clients in late-stage dementia need full assistance with all ADLs and IADLs. Try to understand the emotion behind words or sounds as clues to what the older adult may be trying to communicate. Again, how you say something is more important than what you say. Keep talking. Even if your client isn't able to speak anymore, talk to them about family, friends, and topics or activities they used to enjoy.
Okay, so that was just a short all right, so I guess we're able to learn a lot from that video. So I would like to ask just maybe one or two persons to tell us one. Is well with us today. Is well with network and us in this side today. Okay, how many of us, I guess we must have learned one or two things. Sorry for that break. Network is really, and I don't know why I'm using a 5G router and it's still doing this. It rained heavily over here, so the network is a bit challenging. It has done. So at least we should have learned one or two things concerning how to address late-stage dementia. What someone should please help us. Just one thing that you learned from that video, how to handle someone that has a late-stage, last-stage dementia. Is there anybody who is going to build a cat?
Yeah.
Okay, ma. Good evening, ma.
Miranda,
Okay.
thank you.
Yes, ma'am.
Someone wants to say something.
Okay, Miranda, I thought you wanted to say something.
Yes, I wanted to, but when I heard his voice, I just kept quiet. Okay, so one of the things
Yeah,
I
that's
learned
why I
there
stepped down
is
from it.
one of the things I learned is patience. You have to be very, very, very patient with them because at that point they are not they're not, I don't want to use the words acting like a regular person anymore, but at that point, they are just in a different world entirely. So you have to be very patient with them. And then and them that way. That's what I learned.
Okay.
Hello,
Thank you
ma.
so much, Miranda. Yes, I can hear you. Can you hear me? I guess my
Yes, ma, I
network
can hear you.
is funny.
I
Can
can hear you.
everybody hear me, please? Okay. Thank you so much, Miranda. Patience is the word that I picked from what you said. The major thing, you have to be patient with them. Understand them. Just try to, sometimes when they talk, try to pretend. You know, don't let it get to you. Understand that these people are actually suffering per se. They are actually going through a whole lot. So anything and everything that you can do to ensure that they get better, please write on and do it. Use patience. Understanding is important when dealing with dementia people that have dementia. Okay, Matthew. Mr. Matthew. Good evening, sir.
One thing I learned from
Jesus, what am I going? I don't know. Communication. Maybe I had not communicated effectively with one or two persons. Please, let's mute so that we don't obstruct or we don't we are doing. All right, sir. I'm sorry about that, Mr. Matthew. Go ahead, sir, please.
Yes, ma. So what I learned from the video is when we are dealing with late stage, we should be able to read stories about families and what they would love to hear. Some things we might have idea that they would love to hear. And then to treat a patient like that, I think they should not be someone that scared, because according to what I learned from the video, I think they sleep during the daytime, and at night they can just they wake up. They might not be able to sleep at night.
Wonder. Yeah.
Yeah. So that is what I
That's
just want
right.
to contribute.
Thank you so much, sir. Thank you. That means you actually took time to check, to study, and to understand what the video was actually about. All right. Do we have any other person? We've heard Miranda. We've heard Mr. Matthew. Is there any other person that would want to say something?
Hello, ma.
Good evening. I think that is okay. Please hold on, Fatima. Blessing. Please, let's hear you. Blessing or Chair, let's hear you, please. I saw your hand raised.
Okay, from the introductory part of the video, we saw her making call, and the video they wrote incorrect. So that's like an inappropriate approach to caring for these ones. So we want to maintain their dignity. That's one thing I picked from there. They will be a lot dependent on us. So it's very important to maintain the dignity of these ones while caring for them.
Thank you. That's a beautiful one. Maintain dignity. We have talked about dignity over and over and over and over again. We have talked about the importance. It cannot be overemphasized, not only with people with dementia, but totally when we have to take care of people. It's important that you maintain their dignity. Very important that you maintain their dignity. Thank you for that. Then Fatima, please. Fatima, the floor is yours.
Good evening, everyone.
Good evening, Fatima. Welcome.
What I learned in the video is that we should engage the patients in family activities such as gardening or listening to music, and also to encourage them in physical activities to maintain their physical and cognitive function. I think.
Thank you so much, Fatima. I'm really happy that network did not obstruct, like we were able to see and learn one or two things from there. Engage them in activities that will redirect their minds, activities that they will enjoy doing, activities that will take them away from wandering and sundowning and all the things that come with dementia. Thank you, Fatima. Okay, Mr. Chigozie, please.
Okay. Good evening, ma'am. Good evening, everyone.
Good evening, sir. Good evening.
Most of the things I wanted to say, they have said it, but remaining one. The one that is remaining is
Okay.
that, let me just call it communication is very, very important. They say that the way we say something is more
Correct.
important than what we say. Because there are way you present
That's
a matter,
correct.
the way you say something that will affect them deeply. So we should manage the way
Mhm.
we present anything we want to do. Thank you, ma'am.
Wow, Mr. Chigozie, that's a beautiful one. Thank you so much for that. That one was missing from the puzzle, though some others contributed. Communication, we cannot overemphasize that. Like we keep hammering communication in all our facets, in every angle, whether it's in your social life, your spiritual life, anywhere you find yourself in working with people, it's important that you communicate. Then take to the dementia, people that have dementia, that's another world. They are in another world altogether. That's the way, because the way they reason, their cognitive abilities is declining. So as such, they don't coordinate most of these things. So we have to still ensure that their dignity is intact. No matter how angry we are, no matter how off key they decide to go. It's like you're singing and you don't use the right key. You know how it goes off. So it may go off key from what you actually believe in, what is the reality. You don't have to in any way maybe make them feel less of humans or make them feel sad or bad in such situations. So this is very important for us to note. Thank you so very much for those beautiful contributions. Wow, I'm so happy. So today we are just going to move smoothly. The other module, the other topics will not be so, because I know we are seasoned professionals. So let's continue. Let's right on. So cognitive symptoms, like you already see, understanding dementia symptoms, we've already talked about it. Memory loss, forgetting names of family members. These are some of the things you would see before we get to how we can handle some of these challenges. Difficulties with problem solving, you know, being able to organize things, maybe following a recipe, struggling to manage finances, you know, or to remember people's names, using incorrect words, or having difficulty in forming sentences. All this put together are things that we need to note. I have to be checking the chat box. Oh, thank you, Esther. Okay, Esther, when I was talking, I did not see you, that you had joined us. Esther, you're welcome. I've just seen it right now, and I've seen your comments. We should understand them. Thank you so very much. You can as well put your comments in the chat box if there's no time to talk or you don't feel like talking. So all these things put together as some of the symptoms, cognitive, that affects the brain, that affects the ability to reason. That's the cognitive aspect. So now the behavioral aspect, you see them increased anxiety, they are depressed, they are frustrated, you know, they get angry easily. If, you know, they just get angry over nothing. They get angry over nothing sometimes. And you wonder, so if you understand them, you know that they are passing through a phase. And so you know how to handle them, understand them, support them, give them that shoulder to lean on. Do not laugh at them, because sometimes the things you see may be funny. You know, like a Flourish shared and a couple of people shared too. It may be funny, but do not at any point make them feel bad or laugh at them. You know why? Just like that video you watched. I tell everybody that people that have dementia, not only dementia, vulnerable people, that, you know, for the fact that they are vulnerable, sometimes you may lose guard. You know what I mean by losing guard? That's you may decide to lose guard in the sense that you may think that they don't understand, or they are not seeing what you are doing, or because they are in that state, you can do anything you want to do. No, I tell you a very big no. These people are sensitive. Forget that the cognitive aspect is, they are very sensitive. That is, they can read your behaviors, your non-verbal cue, language, your body language, you know, that you put across. So even when they are saying something that is not making sense, try to put yourself together. Do not show or portray a form of body language that shows them that you are thinking that they have no sense, or that you are thinking that they cannot coordinate. These are things excuse me, we should be very mindful of as CNAs, because you would see a whole lot of them. So just, you know, put yourself together, understand what they are going through, talk to them with love, try to see redirection techniques, how you can redirect that particular period when it's sundowning, when, you know, they become restless, they begin to see how you can make appropriate use of that period, redirect what they are thinking, redirect what they love, take them to what they love to do. You know, we all love to do what we love to do. So regardless of the issue, you can carefully, systematically redirect them from what they are saying. They may be arguing, oh, that's my shoe. Okay, Lillian, thank you. So, you know, there are a whole lot of things that we have to take into consideration. Like I can see here, okay, I joined 10 minutes. Okay, fine, no problem. Esther, you may have been there, but you know me when I talk, maybe I did not check. It's nice to have you. Then Lillian, speaking with them at this stage with face full of smiles will really help. Good, smile is contagious. Wow, thank you so much, Lillian. Just as I said, smile with them, talk to them, you know, and make them feel loved. That's the most important thing. Observe them when they are pressed to use the toilet. Oh, these people are highly knowledgeable people. Check them, because some may not be able to talk. And if you are not observant, like what we have said, these things still dance around what we have said when we started. You have to be observant. You have to do what you have to do. Occasionally, if it's the one that can still move, you have to help them with incontinence issues. You have to help them to use the toilet when they should, you know, intervals. You make them to use the toilet or use the bedpan if it's for those that have mobility issues, because everything they cannot communicate, especially if you have those that cannot talk. Very important. Thank you, Lillian, for that. So coordination and motor skills too. You have to help them. Some of them will have trouble working, balancing or performing tasks, maybe like buttoning their shirts, pulling out their clothes, you know, activities of daily living. That's where you come into play to help them with ADLS. You understand? ADLs, you have to help them with that. Then changes in sleep patterns. Sometimes they get insomnia, they are not unable to sleep, you know, or sometimes they sleep over, especially in the afternoon, they can sleep over. In the night, they find it difficult to sleep. And then the wandering too, because they cannot sleep, there is wandering, they have to move around, you know, wander from place to place. Some of them as much as even open the door, if possible, if they can open the door and go out. Wandering is another thing that is very, very, that we really need to be mindful of, because if you have them, you see that they want to go out, they want to wander. Sometimes they would like to leave that vicinity, and where are they going? They don't even know where they are going. So it's advisable in most of the care homes and hospitals, they use handbands. They have handbands with their identity on the handbands. They have identity, their names, their numbers, so that in the case of maybe for any reason they wander, they will easily be found. That's important. So if you have these people, you have to be careful as to their movements. Very important, so that they don't wander, and then at the end of the day, it's another thing that we are talking about. So we have the physical symptoms too, the coordination, the motor skills, like the movements, balancing, doing things with themselves, their hands and their feet, and so on and so forth. Then we have the social symptoms too. Like I talked about my grandmother, that was the heart of every party, but when at a point, she began to, you know, she couldn't go out again. She avoided social interactions or family gatherings. She will not want to go anywhere that is not familiar. That's the word. They want to see familiar faces. And even when they see these familiar faces, are you sure that at the end of the day, they will actually even know them? That is it. So these things are just, it's not easy. To be very candid, the truth is it's not easy for anyone. So if you have someone that has dementia, you need all the techniques you can get within your fingertips to be able to have a hitch-free care process with that person. You know, sometimes to even recognize them is a problem. There are a whole lot of things that come with this issue of dementia, different faces, behavior, and so on and so forth. So these are some of them. Then you have the hallucinations. There are more, you hallucinations, things that speak of things that are not even real, as if they actually saw it, as if it actually happened. You know, they saw somebody in the room, and, you know, sometimes they hold their false beliefs, despite evidence to the contrary. They can hold on to, for the ones that can talk, they can say these things, the things really look real. You see, I remember one soldier that was living near us. He retired from the US Army for many years. He had retired, you cannot even count, like he retired for over 10 years. But each time you see him pick up his uniform and His uniform, you dare not touch it in that period. You dare not. The family members, they keep it there. He treasures that uniform. And when it's time, when he's having all those a crisis, or the times, the heat of that dementia issue, he'll pick up the uniform. He will say he wants to wear that uniform because he wants to go to work. He'll tell the children that, can't you see I'm late for work? You're supposed to have kept this for me. You're supposed to have kept this. Open the door. The car will soon, the driver will be coming very soon, shortly, to come and pick me. I don't want this nonsense that people always do. When it is time for me to go to work, I mean, seriously, and the children will be like, oh my God. The children will be like, you see the frustration in their faces, as at that time, this knowledge I have now, I didn't have it then. Maybe I would have helped them. That's why knowledge is important. I hadn't gotten the certifications. I hadn't attained the heights with which I am now by the grace of God. So I couldn't help because I didn't know. And of course, if you don't know something, then what can you do about it? There was nothing I could do. So, but as I began to get the right knowledge over the years, I have seen that it's just like a pieces in a puzzle. It has fit in. I understand why these things were actually happening. And I knew I could have done otherwise if I had the right knowledge. So holistically, these are some things that happen. There are a whole lot of issues. There are a whole lot of issues with dementia. But just like every other thing, and as you have the humanitarian heart, you have humanity in view. Your duty is to take care of these people. Anything that you can do to make them get better. For those that have entered the third stage of dementia, that is serious, anything that you can do to help them to preserve their lives, for them to live for as long as God would want them. Because the truth of the matter that I must tell you is that, especially when it gets to the third stage of dementia, it takes only God, because there's nothing God cannot do. It takes only God. But aside that, the chances are slim. That you are just helping the person to linger. You are just doing everything you can to help the person to manage. You help to manage in the management level, and to just give that end of life care that you can actually give to them, because of course they will not stay for too long before God calls them. So thank you, Genevieve. Beautiful. Empathy matters a lot at this point. We've overemphasized that. We've talked about it over again. Communicate in a way that will not distress them. We said that. Establish a routine with their daily care plan and maintain a support system and self-care. Labake, this is beautiful. Beautiful. Then I will have to contact you when we have people that have dementia so that you can handle, because I know you are ready. You are ready for the game. Thank you, Labake, for that. So we want to now look at strategies. I know strategies that we can handle dementia patients, strategies that we can use in communicating, in actually doing the things that we need to do with them to ensure that we have a hitch-free process. Now, what is the first thing? I would like us to take our break by when. Okay, let's see how it goes soon, shortly. I don't want to stay the time. Let me see how we move till when we get to some minutes to that time. I'll let us know. So strategies to handle. 1, use clear and simple language. Very important. Speak in short, straightforward sentences. Don't bring bogus, ambiguous statements to them. These people are struggling with a whole lot of things. Their cognitive ability is already declining. And so you don't have to use clear and simple languages. Be patient and allow time for response. Be patient, allow time for them to respond, because it takes them time to talk. For those that are still able to talk, maybe second stage, they struggle with it takes them a lot of energy and time to be able to put words, to form words. So be patient with them. Allow them to respond when you ask them things. Use non-verbal cues too. Non-verbal cues. Show them signs. You want them to do something, communicate with them non-verbally. For those that cannot actually talk, you understand, and maybe have other challenges, talk with them. Use non-verbal cues. Maintain eye contact. Okay, we're talking about using non-verbal cues. You could use facial expressions. You could incorporate gestures, signs and gestures, facial expressions, your body language to reinforce a message and show engagement. Maybe you've said something. You could use your body language, show signs that will buttress what you are actually talking about, you know, to show engagement. So that you are sure that at least they are able to, you know, understand what you are doing. For instance, okay, we talked about, sorry, I have to take you back. We talked about allowing time for responses. After asking questions, wait at least 5 to 10 seconds before, you know, for them, wait for at least that 5 to 10 seconds before the response comes. This is very, very important, before repeating it or prompting for an answer. So you cannot even talk once and leave it. When you say that once, you wait a little to observe. You remember all the things we learned, to observe and find out if that person has actually comprehended. That's the comprehension aspect of it. If the person understands what you are saying, you understand with the patient, before you either repeat what you have said or you prompt for an answer if need be. Oh, did you understand what I meant? Or did you mean I should do this? Prompt for an answer. Always take your time with them. Non-verbal cues, smile, like we talked about. Always smile, nod, you know, to encourage the person to continue speaking. You know, there's how someone talks to you. Like some people already know, yes, you are nodding your head. The person is like talking. And how I wish this was physical, would have been able to really understand what I'm saying. But I know we understand. It's like maybe your husband talking to you, you know, I'm going out, before I come back, you know, there are some gestures that you do, okay, nod your head to show that, okay, I've heard you, okay, you know, some gestures that shows coordination, that shows engagement, and it will make your husband know that, okay, my wife is respects me or understands what I am saying. You know, these things come into play even when you are relating with a patient. So smile and nod, encourage to encourage the person to maybe continue speaking, or use hand signals to indicate actions, maybe pointing, you know, to a chair, just as we watched the other video. I think one of those days last week, we watched that video on those veterans, proper way to communicate and feed them. You see, so you see pointing, sometimes you can decide to point. Maybe you see that she's exhibiting some form of restlessness and maybe not able to tell you, I need to stand up, or I need to be repositioned, or I would like to, I've been lying for too long, I would like to sit down. So, you know, it's either she can point to the chair, or you sensing some form of restlessness or uneasiness, you could, you know, would you like to sit down? You could even point to the chair, which is emphasizing that you are asking if you can assist her to sit down. So these things are important. We use non-verbal cues to engagement. Then maintain eye contact. Position yourself at eye level and maintain eye contact. Again, it is important we note that people have cultural preferences. There are some people that you looking them in the eye on a fine day shows disrespect, but that's only in few cases. To a large extent, looking at someone, eye contact, maintaining eye contact when someone is talking to you creates a form of connection. It creates a form of connection. It creates a form of attentiveness. It tells the person, oh, you are listening. Oh, this person holds me in high esteem. That's why the person is listening to me. Now with this era, is one trait, one virtue that we should instill in our children. Like I'm saying it because like I have grown-up children, so I try to talk to them, and I'm happy they are changing, or they have changed, because most times you are talking to them and they are on the phone. Like you are saying, okay, son, do you know I wanted you to do this and do this? Okay, yes, mommy. They are answering you in the affirmative, but they are not looking at you. They are on the phone. They are either, you know, on the phone, listening to chatting, doing one thing or doing the other. So I have had to correct my children a couple of times, once or twice, and I'm happy that it has stopped. That when someone is talking to you, you are not supposed to be doing another thing. If you are doing another thing, it immediately sends a signal to the person. Let's remove the aspect of dementia now. It sends a signal to the person that you are not attentive, that you have no respect, or you have no interest in what that person is saying. It's just like a teacher teaching and you are not paying attention. Maybe you are fiddling with a phone, or you are doing something that is off what is actually happening. Of course, you know what that means. So that's how it is when we relate with these people. You know, use eye contact, create connection, demonstrate attentiveness, demonstrate respect. When talking to them, you can kneel if need be. What I mean kneel to be on the same level of the person. If you are too tall, you don't allow them to look up at you. It's wrong for them to be looking up at you. Come down to their level. You can kneel to be on their level. You can sit beside them. It's any of them can be used interchangeably, And when you stay at that level, it shows interaction, like we are saying, and it makes it more personal. Also, remember the cultural preferences we talked about. Some people may not see it as respect, but it is in few cases. So whatever you do, it's important that you take note of the cultural preferences of people. You should be able to understand people and know what they like. There's what I can do to Hembadon that she'll take it easy, but I can do that same thing to Mildred. Mildred may like, oh, why should Dr. Mrs. Dorothy do that? I'm not happy at what she did. You see, that's individual differences. So when we treat these patients, we relate with them, we should understand that we need to know what we need to understand their cultural preferences and what they love best. We should align with what they want, respecting their preferences and taking into cognizance individual differences, that people are different. Okay, so you use familiar names too, like we had a video the other time too, that showed us how that guy was referred to. I think John, if I'm not mistaken, the CNA called the first name because everybody in the facility know that John prefers, when you call him that name, it makes him be at ease and is happier to relate with you. So when you deal with these people, address them by their preferred names. Use familiar names that resonate with them, names that will resonate with them, names that are familiar with them, names that they find easy. You understand? If someone that has a nickname that he likes, you can use it to help him feel more comfortable and engaged. Don't forget that all the things we have been talking about, as you are making it better for the patients, by extension, you are making it better for yourself. Because if you can handle these people, it will be less of a challenge on your path. You have a smooth ride in your workplace. You have a smooth ride doing your duties because it will just be a very happy day for you. You won't have challenges a lot. So it's important that while you are doing these things for them, you know that doing it is not only for the benefit of the patient, it also helps you in the line of your duty, and it makes work easier and more enjoyable for you. And who doesn't want to do a job that you'll be happy doing? Everyone. So it's important that we learn these things. Okay, avoid open-ended questions too. Avoid questions that are open-ended instead of questions that require elaborate responses that will explain, someone will explain and have to talk more and explain. Avoid those when you are dealing with dementia patients. Just go straight to the point. Ask them closed-ended questions. Ask them questions that they can say yes or no, simply because they are struggling with how to talk and a whole lot of things. Simply, oh, would you like soup? So instead of maybe you want them to eat. Instead of saying, what do you want to eat? Instead of saying, what do you want to eat? Why don't you say, would you like soup for lunch? And you hear that is a closed-ended question. The person will either say yes, or the person would say no, and it makes it easier. But say, what would you like for lunch? You are making the person to talk more. I would like to eat, and making a longer sentence and, have to do a lot of using the cognitive ability that is already declining. So ask open-ended questions. 2, use reminiscence techniques to encourage discussions about their past. Now, let me pause here quickly and just chip in something. Most of the people that have dementia, they have not lost totally, they have not, that aspect of them about their past that they really treasure to a large extent. Most of them, especially at second stage of dementia, they don't forget it. So the easiest way that you get such people is to help them reminiscence, help them remember those lovely moments. Play it back, make them remember those lovely moments. Like I used to have one military person that lived near us. The best way you can engage that man in a discussion, or you can get the better part of him on any day, is for you to try to tell him about the military. Just all you need to say is just to say something about me, and he'll say, oh, do you know I fought the Biafra War? When I fought Biafra, he will tell you everything. He will tell you, and it's you yourself, you visualize it as if you are actually in the war front and fighting that Biafra War that you did not even see. You understand? So it helps him. You see his face lights up anytime you bring those things that he loves doing. You just see the joy on his face, and he just comes to life. You just see him light up with smiles, and he's happy to tell you. And he can talk over and on and off and over and over and over again till you look for a way to excuse yourself and then leave. That is it. So these people, for you to get them, encourage discussions about their past. Over time, you must have observed the things they hold dear. If it's about their grandchildren, if it's about their lives as when they were teachers, maybe for those that were teachers, or maybe their lives as people that were in the army or people that were medical doctors, you know, you will have a good knowledge of them and what they love. Because you are not a doctor. Because you are not a doctor. For a doctor, it will be difficult, a little bit difficult. But for a certified nursing assistant, because you have been trained and because you interface with them more often, you would get to know the sweetest part of them, the things that they hold dear, like the picture that lady held when I began giving you that illustration, the picture she held in her hands, remembering her marriage, even though she didn't remember the people around her, but for her to remember to hold on to that picture, it means that it had value to her. It means that it could have a major part in her life that could help her. You understand? So these are things that we need to know. Anything that could help stimulate their memory, could help build some form of connection. You could show them maybe a picture from a family event. It could be about people in the picture. It could be about the people around, you know, maybe their grandchildren, you know, these elderly people, they love their grandchildren, you know, to run around. If that's what you know that will light up their day, will give you that glimpse of hope, you know, will make them feel happy, then why don't you do it? Why don't you talk about those things often? Of course, anything that makes us happy, you and I know that aside the dementia scenario, that we love to talk about it. Everybody loves things that will make you happy, things that memories, sweet and lovely and loving memories, you understand? So do these people. Forget about their cognitive state in a bid to help them. Show them pictures, show them things they love. People that love to, you know, in this our side, over this side, we are not looking into the works of nature, but outside, go to UK and all the whites in particular, they love to, you see an old woman that just wants to drive. Maybe if she cannot even walk on her wheelchair, you just wheel her to the garden. She just wants to see her roses. She just wants to look at the colors of the roses. She just wants to, you know, feel nature and just, you know, begin to, feel better. So people have what they love. If you take my grandmother to the garden to look at her flowers and her maybe vegetables and her flowers and roses there, you have not done anything. You have not even started. In fact, you don't know what you are doing because it makes no sense. But if you take a white lady and people that have lived most of their lives there, they have a different orientation. So you can, if I have a grandmother like that, I'll take her to the garden. I'll do the things that she to live. It's not unwanted. When you are talking to them, they can distract them and make them. You understand, especially when you are having conversations with them, to help individual focus. Let the focus be between you and them. Do not distract them with background noise. You know, so if you are dealing with them, you can move to a quieter room, somewhere that is quiet, or you turn off the TV when you are having an important discussion or something that will just distract. Make sure you do away with distractions. And then provide reassurance and support too for them. Offer gentle reassurances and support to help them feel secured and valued. Like we watched that video. Oh, that video is so nice. I love it so much. Anytime I have trainings, the one we watched the other time, we used it for ADLS, activities of daily living. It can also come into play. That's why I had that video, so that I prepare your minds. You know, talk to them, provide support to them, let them know that you are there for them, and tiny encourage them when they take little gentle strides. You know, we humans, we like encouragement on a very fine day. So when you see that they take little strides, encourage them. If in terms of movement, they can walk a little, oh, you are doing great. You are doing just fine. I never thought you'd be able to. You are doing great. Well done. You know, give them, when those words make them feel valued, they will be happy that, yes, I'm actually doing. I can make it. I can do it. You know, help individuals feel secured and valued. Help them feel secured. Help them feel valued too. Help them feel secured, you know. Help them feel valued. Help them feel important. Use phrases like oh, I'm here to help you, or you are doing great, to build what? Their confidence, to build their trust. Because when they trust you, when they have confidence in you, it makes your job easier, and it makes the routes to their recovery faster. Very important. That's why you see, I tell people, don't be amongst the people that will say, I don't want to be spiritual on this platform, but there are a whole lot of people that have issues because of my grandmother is a witch, this one is a this, and they abandon these people because they don't understand the intricacies. They don't understand what these people are passing through. So take, for instance, it's even difficult for aged people having dementia, to have loved ones, to have people that care for them, that are around them, that care for them. It's difficult with them. Let alone an aged person with dementia that has no help, has no child coming around, has no loved one coming around, is just being abused. Let me use that word, because that's abuse, on the pretext that the person is a witch, or the person is this, or our Nigerian perception of some of these things. So it's very wrong. We should care for these people, because I tell you, what goes around comes around, and you may never know. You may never know. That's just the summary of what I want to say. You may never know. So incorporate visual aids too. Use pictures, use written cues, like pictures, like that picture of the woman. Use objects that are familiar to them. Let them see, let them know what is actually, let them see, let them know what is actually obtainable, help them, help them to communicate in such a way that they will be able to understand what you are doing, any way and every way that could be easy for them to understand. If discussing lunch plans, you can show them a menu instead of telling them, oh, you can show them if they can see, because it's not all the cognitive abilities, not everything that just goes with dementia. Any way, any means that okay, any means or any way that that you would be able to handle them, or you'll be able to, do justice to them. It's very important. Employ these strategies, So it is important that when we employ all the strategies, CNAs can help to enhance their communication with individuals, in any stage of dementia. With patients, they can interact, they can show empathy, they can show creativity in communicating with those people. And at the end of the day, it will be easier. It will be a walkthrough for us all. So that having said, let's, I don't know, do we have any questions? Do we have any contributions? Because we are going to take our break exactly 8 o'clock, and then we'll be back 8:10. We'll take 10 minutes break before we come back for the next part of it. The next part of it is actually not much. It's just a walkthrough, and then we'll be done for today. Are we together? Do we have any questions so far, or any contribution?
Yes, we are together.
Okay.
Yeah, together,
Okay.
ma.
Good evening, ma'am.
Oh, somebody saying we are together, ma. Mr. Chigozie, was that you?
Yes, ma.
Hello,
Are you,
ma'am.
are you tired?
Very,
Good evening,
very
ma'am.
tired.
You are tired?
Yes, ma.
Oh,
Ma'am.
good evening. Good evening. Mr. Chigozie, please don't be tired, eh? It's fine.
It's not the lecture. It's not the lecture. The work today.
It's tiring. Don't worry.
Yes.
Don't worry. God will crown our efforts with success, really. Don't worry.
Amen.
Amen.
Sorry about that,
Amen.
yeah. All right,
Yes,
Genevieve.
Ma'am, it's just a personal question, though.
Okay.
I want to know, as a CNA, how many patients are you assigned to at every point in time, or are you allowed to look after? Just considering the attention given to most of the patients,
Okay.
and especially when it comes to dementia patients,
More time.
when you talked about them wandering about, are you to leave them all to themselves, all by themselves, with all the kind of assistance they need? So I'm just thinking to myself, how many patients CNA is allowed to attend to at every point in time? Just a personal question. I just want to have
Okay, it's actually good you asked. Like in the course of us taking these trainings, we we've had one or two persons really express their thoughts saying, are we sure we'll be able to do all these things? Yes. Now, that your question, I cannot categorically give you an answer because it depends on the setting you find yourself. Take, for instance, you can get to some hospitals and then you can get to some hospitals that have more hands. You can get to some that have few people that have to do have to move rounds, do their rounds. With that's few people, the staff, short staff, let me say so. So first and foremost, it depends on the facility that you are actually going to work. It depends on the facility. Take, for instance, there are some schools, let me relate it to schools. There are some schools that have a lot of work. You see one teacher teach mathematics, the teacher teaches statistics. Sorry, not statistics, teacher teaches further maths, the teacher teaches a whole lot of things, one person. Why? Because they are short staffed. So you see that the teacher will have so many things to do, so many classes to go in, so many periods in a week. But it can be in another school where they have more hands. You can find out that one teacher can just be taking one or two subjects. As such, the pressure is not too much. So it depends on where you go to work. That is just the answer to what you are asking. It depends on the facility and it depends on the policies of the places. There are places that they have many hands, as they have a lot of people working. I know in Nigeria, let's not talk about Nigeria because we know what happens in this part, but out there, these things are regulated, because they try to have a specific number of people that will actually do the rounds and do the work and then shift. Sometimes you have to work 8 hours. Sometimes you have to work 10 hours. Of course, you leave, another person will come and you are not the only one working. You have other people too. So it's not cast on concrete. That's why I cannot tell you exactly that you have to attend to this number of people within this number of time. No, because it varies depending on the policy of the organization or the policy of the institution. Is very, very important. So, but on the whole, when it comes to dementia patients, like I said, that you can actually major in a particular field. You can decide to major in a particular field. So you can decide to be maybe a dementia certified nursing assistant. That way, you are only attached to those people with dementia. And then you have other hands too. You have other people. Remember, you as the CNA, you are just one out of the curtain. You may have the nurses there, the registered nurses. You may have maybe these healthcare assistants. You may have a whole lot of people. So everybody works together to do a particular thing, even though you have your own different job descriptions, So on the whole, it's not cast on concrete, the number of people you attend to. It depends on the environment and it depends on the setting of that environment, whether they have enough hands or they have few people. Because if we say you have to attend to only 3 people now and you are taken, maybe you get to work in a place where they are short staffed, of course, you will not align with that. You have to do justice to the money you are being paid, and you know how Nigerian syndrome can be. So they can want to exhaust you and milk you out. And at the end of the day, you go tired and not able to do anything. So it depends on the place. Mr. Chigo say you are really funny. Be assured that you'll be
so much,
in Nigeria. You are welcome. Genevieve, you are welcome. So if it's Nigeria, just as Mr. Chigo say just be rest assured that you'll be used roughly. That as you walk until you cannot walk again. Well, I wouldn't say it's true or it's not true. It depends, again, on the place that we work. So thank you, Genevieve. Do we have any other question or contribution? If on
somebody asked for a question.
Okay, to ask for a question. All right, please do ask.
Yeah, good evening, ma'am.
Yes,
everyone.
That's Adeswa, right on.
Please, ma'am, I wanted to ask, can a young person have dementia? Or is just coupled with old age?
Hello, I cannot hear you, Adeswa.
Can you hear me now, ma'am?
Examination to be able to carry a series of tests and then to be able to know whether the person is actually having dementia or not. But is attached to old people that have a lot of issues, health issues and everything put together. So I don't know if that's okay for us. Let's go ahead. All right, so we want to, is there anybody else with any question? Okay, Mr. Alex Newben. It's nice to have you. Mr. Alex, good evening.
Maybe it's network.
Oh my God, what's happening to network? Hello?
I can hear you, ma.
Because I'm not hearing anybody. Mr. Alex, can you hear me? Okay, maybe he's not able
I
to
can hear you.
All right. Okay, a hand is raised. Mildred. Okay, Mildred, please.
Please, doctor, I have a question.
Yes.
What's the difference between we say dementia is loss of memory, and we have cases instances where some people have accidents, the way they're involved in an accident, or maybe falling or a road accident, and they will say they lose their memory, they can't remember anything again. They can't remember their past life, what they were before. Some cannot even remember their name, even at that young age. Can we also attribute that to dementia? Thank you, ma'am.
Okay. Thank you for that question. Now, I want us to understand from what you said, there are times, yes, it happens. There are times when maybe due to accidents or due to severe trauma, there are times you have, accident, then you have severe trauma, especially to the head, that can result in memory loss. And memory loss is a kind of illness that is common. If it's memory loss, exactly what we're talking about, is common in most. There are some illnesses that are aside even dementia that can make someone to lose. It can affect your stroke most times. Stroke is one thing. Someone having stroke, it can affect the parts of your brain. As the part of your body is not functioning, so is a particular part of your brain, can result in memory loss. So memory loss is not only related to dementia. Now, in terms of someone having an accident, maybe as a result of trauma, as a result of the impacts, severe impacts to the brain can make someone to have memory loss. It's just one of the signs of dementia, but it is important to note the circumstances with which the person has had the memory loss. Like you said, if it is one that is resulting from accident or severe impact, then you cannot fully attribute it to the fact that a person is having dementia, because dementia is a whole lot of things. Your cognitive ability, being able to interact, your social life will be affected. A whole lot of things will come into play. You forget names. You will not be able to, looking at the physical movement, it will affect your movement if it gets to the last stage. So memory loss, if a person has memory loss as just a single challenge, single-handedly, resulting from the impact of an accident or anything, it cannot be said that the person has dementia, unless if that memory loss occurs after that and the person is checked. That's why I say that everything depends on the specialists, to check, go to the hospital and confirm. Then they now use all the yardsticks to measure. They now look at all the signs and symptoms that the person has associated with that memory loss, that comes with that memory loss, and with some observation to see whether the symptoms would progress. Then we can say that the person has dementia at a particular time, as in with time. You understand? So it depends on what actually made that memory loss to result. If it's on a very fine day, someone just starts forgetting, it starts gradually, the condition deteriorates, the person cannot walk and all other things. Good. But if it's a result of an accident, then certainly that person needs a lot of evaluation, because accident alone can interfere with your sense of coordination and reasoning, and you begin to have memory loss. And if you have that memory loss, it cannot be said that you have dementia, because it's as a result of that. And another thing I want you to understand, if it's a memory loss for dementia, it takes a long time for it to be treated. Not treated, but it takes a lot of processes, you understand? And most times, to 70% to 80%, the person does not recover. There's no need the person does not recover. But if it is a memory loss that results from an accident or that results from trauma to the head and it's not full-blown dementia, then there are other strategies, there are other things that can be done on that person to help the person to regain his or her memory. It happens many times. You see, people can just have memory loss for a long time, but with all the techniques, you gradually put two and two together, follow the right, give the right medications and everything. After some time, it may be a year, it may be one sudden day, something can just happen and the person recalls, like we used to watch in Nigerian movie, the person recalls and the person begins to remember what actually went wrong. Especially those of us that watch Indian movies, you know, we will understand how that kind of thing used to. So that's how it is. But for dementia, to a large extent, if it continues and deteriorates, it's always is always a 70-30 chance that the person will actually be able to come back to how it was before. So I don't know, Mildred, if I have been able to an extent, do justice to your question.
Very well, ma. Thank you, ma.
Okay, you're welcome. So, someone says surgical. Oh my God. Okay, so let's continue. That being said, I said we'll have a break. What is majority carries the vote? So what are we saying right now? Do we take the 10 minutes break? Is that okay by us? Do we take the 10 minutes break or should we continue?
Yes, ma'am. Break, please.
Okay, thank you. So let's
Yes,
take
ma'am.
the
We had a stressful day in the office today, please.
Sorry, Bele. Sorry. Fine. So let's take the break and we'll be back by 8:20. Exactly 8:20. Just a few minutes. Thank you.
All right.
Okay. Hmm. All right. Hello, everyone. Are we back?
Hello, yeah. We're here.
Some people never left.
We are here. We never left.
That sounds like
We're waiting.
Okay, Mr. Chigo said, did you leave to stretch your leg?
If I leave, I
I
will
was
fall
saying,
asleep.
oh, sorry.
It's not yet.
Okay. All right. Because if you tell me you are falling asleep by this time, it's not ideal. You have to do what you have to do. Not fall asleep by this time. All right. Let's get to work now. We want to look at dementia tips, like we said. This one is just a rundown before we move to the last module. The last module is quite short today. So one way, these are some of the ways we can help to manage aggression, reassure your loved one, take them to a comfortable environment. There are strategies that you can use. Stay calm and composed. How you can manage aggression, because of course aggression will come. Sometimes you see them really show one kind of attitude that, if you don't have that love, if you don't understand, you don't have a good some issues. You understand? So you have to, for example, if you have a patient that is yelling or acting out as a certified nursing assistant, you can have some of them that are very difficult, maybe shouting, yelling in the ward, like people will really think you actually did something. It happens. There are many, it's not a walk in the park. So you can have such situations. What you need to do, take a deep breath, speak soft. Who is doing that? Help us to mute. We don't have much time so that we can go on time and people can rest. I understand how it is. So, what do? You have to make sure that you speak softly and you avoid escalating the situation. Because when the patient is shouting, how this dementia can be frustrated, people will come. So you take a deep breath so that you don't get angry, like we are humans after all. Bottle it up, try. Speak softly and avoid escalating the situation with raised voices. These are things that we need to actually understand. Approach the patients slowly, it's important, and maintain an open posture. Avoid crossing your arms or making direct, things that's making some kind of, not insinuations, but talking, that is not very good. Stand slightly to the side rather than directly in front. These are some of the things that we need to know. Who is doing this thing now?
I don't know.
Lillian.
Okay, Lillian, please. Lillian, from your end, can you help us? Thank you. So, as we were saying, wahala.
Good morning. Hey.
You see, this is some of the things we are talking about communication, and where is the best place to actually showcase?
Admin can mute Lillian and Fatima. Their mics are open.
That's what I'm trying to do.
I should let them unmute it.
That's what I'm trying to. I know it can be muted, but it should be from the end of MJB. From my end, I don't think I can mute it. Okay, fine. Let's hope that I've tried to. Thank you. So let's continue. All right. So stand slightly to the side rather than directly in front. This is important. Identify triggers. There are things that trigger these people. For instance, maybe if aggression occurs in a group, maybe where they are doing group activities, it may be due to overstimulation. They have stimulated themselves. They've gone beyond the boundary. Identify some of these moments when you see them being agitated, when you see them being restless, when you see them being uneasy. Identify these moments and adjust the environment accordingly. Use distraction techniques. Redirect the patient's attention to different activity. Maybe if they are being agitated about a particular thing, you can systematically redirect the attention to another activity, you know. Maybe you can tell them, oh, don't you think I would like to, wouldn't you be happy, or wouldn't you like us to go for a walk? You know, redirect. And if it's something the person likes, oh, I would love it. Or you see signs of a person, just look for something to do that will take the person's attention from that. It's just like a child. When a child is doing handling something that is not, so you don't outrightly shout and say, okay, drop that thing or not. If you know what to do, you did redirect that child's attention from that particular thing, and you've got that child, you just, before you know, that child will forget about it. Even though these are not children, but I'm just trying to relate it so that you would understand. So that is practically maybe a walk, maybe playing a game. Oh, would you like us to play this game of chess? You know, redirect. You see, if it's something the patient likes, okay, the patient will now leave that agitated situation and opt out for the other one. So these are things that are very, very important. So let's see. MJB, please, maybe you can help us to mute this person that is not, I cannot mute from my end because I've not been made a host on it. So I can't mute from this my end. Okay, and validate their feelings too. Every human being needs to be loved. Validate their feelings. Acknowledge, maybe when you see them being like that, acknowledge the patient's feelings without judgment. Do not be judgmental. Don't judge them because you don't know what they're passing through. You don't know what they're actually feeling. So minus even them, you shouldn't judge anybody. That's just the thing. Don't be judgmental in your approach because things can happen to anybody. So if someone is passing through something, show empathy instead of being judgmental. So acknowledge their feelings, you know, it will make them feel understood and it could reduce the agitation. If they know that you understand what they're feeling, it helps reduce the confusion that they have, you know, that they're feeling. Keep familiar objects around them. Label drawers and cabinets will help them to avoid confusion. You know, you could keep an alarm system for them that will remember tasks. Again, it depends on the level of dementia and all these things. It depends on the stage of the dementia. It may not be applicable to some of the stages, especially the third stage of dementia. If you like, put an alarm clock that will ring the whole this thing. If it's the last stage of dementia, well, so you see the stage that it actually aligns with, and then you make good use of that. Offer choices. Give the patient a sense of control. You can give two choices or three. Don't give them too many because you know give them choices still. At least let them still make a choice. You could ask them, would you like to go for a walk now, or would you prefer we do that in 10 minutes, or we do that later? You know, it empowers them to feel loved, you know, valued, and it can reduce feelings of frustration that they actually have. Use gentle interventions if necessary. If a patient is maybe attempting to leave the area aggressively, there are some that want to leave the facility. They want to just go. They want to leave that place. I want to go home. I'm going to my house. I cannot stay. It's not easy. So if you see like that, you know what they are going through, you know. So sometimes in such situations, a familiar face can help calm the situation. Maybe if they are feeling nostalgic, maybe they need to be at home, they need to see their family and all those kind of things. You could help by notifying the nurse, like you are a certified nursing assistant, to ensure that a family member that is familiar, a familiar face comes. It will help to help with the tension the person is actually having. Educate and train continuously. That's another important technique. Keep yourself abreast with all the techniques and requirements. Issues of sleep. Maintain consistent bedtime routine. Create a consistent bedtime routine. Help with that. Avoid caffeine. Caffeine is something that disturbs most people, depending on the health challenge anyway, but some people take anything caffeine and it's just like Nescafe and anything like that, you cannot sleep. So avoid anything that will further worsen the situation that is already on ground. Remove electronics from bedroom. Anything that will distract, maybe when they are actually taking that sleep, taking that nap, let nothing disturb them to, you know, drift them out of the sleep unnecessarily, because it will add to the challenge. So it's not easy handling these people. Overly, it's not easy. Here we have some questions, but we are actually dealing with time. There are people that did not do the assignments that was given. So I'm pleading with those people to do my assignment, because I have seen and I have taken my own assessments. Only a few people did the assignment. Perhaps, like Dr. Mrs. Dorothy is, some of us may think, oh, maybe she didn't mean it, or it was not a serious thing. Let's just rest. Fine, I have no issues with the resting, but I know that the assessment was already given. So please, if up until now that I am talking, you have not done the assignments, then I have other assignments that you would do. The second batch of the assignments that you do. And the people that will do it are people that I haven't really seen their work since. I've taken note of the people that have done it, and I have assessed it in my own way, my own record. So now the next batch of people will be the people that will answer this one, because we're actually supposed to do it here, but if we do it, time will run against us for the second module. So we have to move, but these questions will be given. You have to take care of someone 3 months. You've observed some things. What are you supposed to do? They are just case studies, like 3 case studies. You pick one. The people I asked to do the other one, I remember I emphasized that they should pick one, but I've seen that a couple of them did the 3. They did the 3 and they brought it. So if that's what they wanted to do, obviously I'm just going to pick one, because the instruction I gave that time was that we should do one, so that this week we'll do another one. But if you have done that one, the people that have not done that one, please, you have to do this one that will be given to you if you haven't done that one. So make your choice. Overlay, I'll take that attendance. It will be added to your other records, and I'll forward it to appropriate quarters. So now, let's quickly look at, like I said, this module doesn't have too many. I think it's just for us to look at everything here. We look at it and then understand it. That's all we have. We have talked about the dementia care. We've looked at and had an overview of that. And then we want to look at health and safety regulations. We had said something like that when we had the safety procedures earlier in the module that we had. We had something in that regard, and that was safety and emergency procedures. Yes, that was what we had. So now we want to look at health and safety regulations, which is still in line with the other one, but slightly different. Now, there are many things that happen to CNAs, to workers, especially nurses. I thank God I made that illustration earlier in the time I had this training, how I almost lost my child because of the lackadaisical attitude of the midwives on duty that day. So this is one very important thing. CNAs must remain alert. We are talking about health now. We're talking about safety. You must remain alert and attentive during your shift. Sleeping on duty can really, really, really jeopardize your patient's safety and care. We cannot talk about that one overly. That's why we have shifts. If you are not on, you are not on duty, you can sleep. We know how our body system is sleep. If you are on night duty, ensure that you are fit for the night work. You understand? You know you're on night duty. So if you like to sleep, if you like sleeping, then you should ensure that you create time to sleep. Very important in the daytime, knowing that you have a task ahead of you at night. Like me, I like to work mostly at night. So I sleep in the daytime. Anytime I can get chance, I'll just tell the secretary to move on and go ahead. Because I know I like to do a lot of things at night. It helps me, so sleeping on duty is not advisable. Now, imagine maybe a CNA who works night shift, and one evening after a long week, she feels exhausted. This job is strenuous, I must tell you, and we want to, Lois, please help us. We want to relocate. Yes, we want to be nursing. We want to earn in dollars. We want to have euros. We want to have pounds. But this job is not a walk in the park. It's actually stressful. So imagine that maybe you are working nights. You should make sure that you rest. Maybe one evening after a long week, you work and work and work. You are tired, exhausted, and you doze off on a chair while watching over your patients. Imagine what can happen in that split second that you doze off on the chair, because I've seen it, especially in government hospitals, I've seen it. You see this, they either go and sleep or they look for, in fact, in the night, anybody that is on night shift is even happy because he or she knows that it's easier for him to sleep or her to sleep in the night, because the supervision will not be like top notch in the night. People will lose guard, But if it's in the daytime, authorities can just come in and they'll catch them sleeping. So they prefer night thing. So they don't care whether it's night shift or day shift. They just want to sleep. in the night, and they don't care what happens to their patient. So imagine during that brief time you sit on the chair and close your eyes and say, oh, I'm exhausted or I'm tired, and you doze off, something happens. And your patients, you know, there's a way the devil works. Maybe that time is the time that your patient wants to stand up actually to go and do something, maybe to go and in the process, the person falls or, you know, resulting in an injury. This incident will not only harm your patient, but will also lead to some disciplinary actions against that particular CNA. Highlighting the importance of staying awake and being alert is very important. So to manage your fatigue as CNAs, I'm just giving you should take short breaks when possible, engage in light, light stretching, stretch yourselves, relax, you know, or walking to stay energized. You can keep yourself fit. You do a lot of things when you feel like. There are times human nature, you can't cheat nature. So you may actually feel that sleepy. You know some things to do. Take a walk around, just, you know, do one thing that will just take your mind off sleep and you get back to the task that is ahead of you. So it's very important we do these things. Schedule regular rest periods. Make sure anytime you have rest, take your nap, take a rest when you are not on duty to prevent that serious temptation to sleep on duty, because it's a big temptation. And it's just like a market. When you have your shop, you are selling things in your shop. I tell people that run a business, maybe have these small shops, that very minute that you leave your shop or that very minute that you go and sleep, that is when the customer will come. That's just the truth. It has happened. It's tested in most cases. So when you say, oh, I just need to sleep, or I need to lock this shop, I've not had any customers since morning. Nobody has. The time you lock the shop and go, don't be surprised. That's when someone will come to buy something. That's the same thing. When you decide to sleep, that's when you'll be surprised that something can happen, and that's the second you want to sleep. So please, let's be mindful of that. Then infection control too, we have talked about that when we had infection control as a topic, as one of the modules in this training. We had infection control. We talked about hand hygiene, how to wear your PPE, and how to remove. Thank God we are close to our practicals. So these things, we are going to learn them firsthand as to how it happened. But we talked about infection control. Now, it is important that to avoid the spread of infection, you have to use your PPE, your personal protective equipment. Use them well and follow standard precautions. Important. Now, let me give you a scenario. Maybe a CNA notices that a patient has developed a rash, you know, this rash that we used to have on the body. Now, rather than investigating further, this CNA proceeds to check other patients without washing his hands after attending to the one that has proceeds to attend to other patients. Later, you find out that several patients would develop similar symptoms. Now, this negligence could have been avoided on a very fine day with proper hand hygiene and awareness of infection control protocol. So you see how little mistakes that we just say, it's nothing, we feel it's inconsequential, how it can create harm. That's just a scenario I gave you. So it is important that we learn how to wash our hands the proper way, not just to put water and rinse our hands. Or some of us that will just say, okay, washing hand, I'm tired. How can do they pay me to come and wash? And I've had somebody say that in the hospital, say, am I paid to come and be washing my hands? And I just laughed when I overheard that, because the person was speaking out of ignorance. If you are not paid to wash your hands, you will be paid to waste your money in the hospital to treat yourself or for you to spread this germ. So sometimes we should be careful with these things. Understand? So it's important that you wash your hands, you use hand sanitizers. Don't be tired of doing these things. Don't be, because you eventually get tired if you land in the hospital or if you get sick. So it's better you don't get tired washing your hands and taking care of yourself. Body mechanics too, we talked about that too, the proper way of transfers, which we are going to see, using the gate belt, using the transfer equipment, the proper way you can transfer a patient from one place to another, and body mechanics, how you lift yourself, which we'll see when we have the practicals, the proper way of lifting yourself when transferring a person, so you avoid backache, because CNAs, nurses, these people that have to do with all these transfers and lifting, they always end up having pain, waist pain as they progress. You know, everything that we go through, it comes when we are aging. your old age, that's when the impact of everything you were doing, you thought you were doing, it will come to you. It will come to me, to every one of us. So that's just the truth of the matter. So when you do these things, you may not feel the impact. You may feel that I'm young, and you keep doing it. But I tell you, if not done properly, the after effect, the accumulated effects of that singular careless and wrong act of you not following the process can go a long way in causing some things for you. So it's very important. Transferring a patient from bed to the wheelchair, attempting to leave the patient by herself, straining her back, and a whole lot of things. At the end, you see the results. You definitely, it's not going to be palatable. Like, you will not be happy at the end of the day. So with that, it's important we learn the proper techniques. Bending your knees, keeping your back straight, very important. That we'll see when we are doing the practicals, your back must remain straight. And then using assistive devices, other techniques that you can, one-man assist, you have in first aid, two-man assist, what you can do, we are going to see it. Then we go to fire safety and emergency response and emergency preparedness. Fire safety. All right, I had talked about certain things like this. You must be familiar with fire safety protocols. We talked about it when we had that safety procedures. Do not just belong to a facility. You don't know where the fire extinguishers are kept. You don't know how to even handle the fire extinguishers. You have no knowledge of anything. It means you are in the wrong place in the first place, because a health facility, the people there should have some certification. People there should have some background training, should have trainings that will help them. Not even in that setting. What if you find yourself in a place where there is an emergency? All eyes will be on you because you are a medical practitioner, and it is expected that you know what you are doing. You should know what to do. That's just it. So like my mother always used to tell me, she said, when you learn something, learn it well. She always used to say that there's nothing as beautiful as you learning and learning well, because knowledge is one thing nobody can take away from you. That's one thing. Even if nobody can take it away. Even as I will disseminate this knowledge on this platform, I'll still take it. And next time, MJB and the Smart Solutions, in this case, and the Smart Solutions will still call me, say, come and do this. And I already have the knowledge. So nobody can take it away from you. That is one thing that people don't understand. If knowledge is expensive, then just try the cost of ignorance. Then you see which one is more expensive amongst the two. So it is important that we know how to use fire extinguishers. There are the different types of fire extinguishers, how they are operated, the PASS acronym, pull, aim, squeeze, and all those things. You need to know them for your own personal good and for the other reason that you are a medical practitioner, like you are in the healthcare field. What to do when there are emergencies, evacuation procedures. If something happens now, do you actually know where to go? Do you know how to respond? Do you know what to do? These are things you need to understand. And this thing that I am saying like this is it's something that will take it takes a whole certification, fire emergency response, fire safety and emergency response, another training on its own. You understand that if you have the financial capacity, please go ahead and do that training. It's important because it will teach you the use of fire extinguishers. It will teach you how to fight little fires. I'm not saying become a firefighter. No, little fires that can be used, that you can actually quench with the fire extinguishers. It is important. We have a lot of these trainings online. Even if you don't want to go with Andy Smart Solutions, you don't want MJB management, you are at liberty to choose anyone. But like what we do for our students, we tell them the things that would help them, the things that will give you that edge that you may not know until you go out there. You see that I thought I was wasting money, but I actually have the right knowledge. It's very important. So CNAs must be familiar with fire safety protocols in every facility, because they are fire safety. Some can be the same, but some are different depending on the facility that you find yourself. Good. Take part in fire drills. In drills, when they do these drills, don't claim too busy. Make sure you are part of it. Now, for instance, maybe one day a smoke alarm goes off in a facility that you work, and you as a CNA, you are unsure of the evacuation routes. You don't know, and you begin to panic. You that is a medical practitioner. If you begin to panic, what do you expect the patients to do? That is where knowledge comes into play. What do you expect those vulnerable people to do? Hence, it is important that you have the knowledge. You understand? Maybe, and if you don't have the knowledge, maybe hesitating to act, putting, yourself at risk and the patients at risk. That is important. Emergency preparedness. How prepared are you to handle emergencies? We also talked about different types of emergencies. We did it. We even played that video. Medical emergencies, what to do. Hence, I emphasized the CPR and first aid. When I was saying it, well, for the CHCA, Certified Healthcare Assistant students, nearly all of them have enrolled for CPR and first aid because it is important. If you doubt me, you can go and do your research. We are learned professionals here. We go and do your research and ask them how important is a CPR and first aid certification to a certified nursing assistant. Ask Google or ask any browser and then find out, give yourself the answer. You would see that is very important. Emergency response, key it in and you see whether it's. So these things are added certifications that can actually make you rise in your NVQ levels when it's added to your CNA certificates. It can help you to get the knowledge that is needed, that will give you that edge, that will keep you up there, that will distinguish you from others. Very important. So if you don't have that CPR first aid, please think of having it, or a BLS, whichever one. It is important. It will help you, just as the mental health awareness certification gives you that edge that BCC is giving to you. So let's continue. Now, you need to have that background knowledge. Then patients' rights and confidentiality too. Patients have rights for privacy. Keep their information. We have overflocked that already. Keep information. Do not divulge. Do not disclose information to others. Their information should be protected. It is your duty to protect their information. It should not be through you that the information should go out. Let it be through any other person that doesn't have the right knowledge. You understand? Just like they say that Jesus died, that it was meant for Jesus to die, but they said, woe unto him. Through him, that is instrumental to the death of Jesus. That's for the Christians. For the Muslims, I don't really know what is embedded there, but I know Muslim and Christians have the same things, almost the same things in the Quran, and the Bible. So that's how it is. Let it come from another person, not from the CNAs that we have on this platform. You understand? So if you have the right knowledge, now you'll be able to know what to do when there is an emergency. And then keeping information. Do not disclose the information. The breach of confidentiality could lead to mistrust and legal issues. If you breach confidentiality, legal issues are waiting, especially outside Nigeria, because Nigeria, anything can go. Even dirty water can go under the bridge. Nothing happens. But when you cross rivers and cross oceans and you cross different weathers and you go to different places, you see that these things cannot just be swept under the carpet. So we have to be very careful that we keep our patients' rights. Let's make sure that we keep their documents confidential, important, so that it does not lead to legal issues and then mistrust. Respect their privacy, discussing sensitive information. Understand that safeguarding is very important. You have to take care of your patients. That's important. And your patient documents should be highly confidential. Abuse and neglect too. That's another one. CNAs, you must recognize signs of abuse and neglect. You clean these people. You take care of them when it comes to abuse. Look at them. Some of them may have bruises on their skin. Some of them pass through a whole lot. They are vulnerable. So some I don't want to use foul languages here, but you get to hear. The other time I traveled, I got to hear that one old woman was molested. They broke into her house and, they raped her. I mean, a woman of 80 years. And you ask yourself, what are they actually, why, in fact, why, what, and how? A lot of questions come into play. So these are some of the things. If you have these people, look after them. If there are patients in the hospital and you see signs of bruises, you see signs of abuse, please report. Report to the in-charge nurse, registered nurse. Financial abuse, physical abuse, sexual abuse, any form of abuse. Please report. And some of them could even have people that neglect them. Their own very family will neglect them. They don't care about their needs. They don't take care of them. Nobody cares about them. Perhaps they have been tagged witches. Perhaps they have been tagged inconsequential, or they don't have value. And a whole lot of things come into play. So you, as a CNA, learn to know the signs of abuse and follow proper channels for reporting. Your channel of reporting, this nurse first, the registered nurse first, and then proper channels for reporting is very important. Your supervisor, and let it move like that. Anything that looks like issue to your patient, please report. Patient safety is paramount. What you observe, documents so that appropriate measures can be put in place to investigate the situation. And then the last but not the least is safeguarding. Safeguarding involves protecting vulnerable individuals from harm. Abuse is almost the same as the abuse and neglect. It goes together. Safeguarding. Now, maybe a CNA, let's say maybe a CNA, Lois, we have Lois here. So let me just say Lois as a CNA is aware of a new patient who has cognitive impairments, you know, and has the risk of wandering. We talked about leaving the vicinity and moving to God knows where, moving into the unknown world. That is wandering. Maybe they just move around with aimlessly. You know, she takes it upon herself. Lois would now need to take it upon herself to ensure that that patient is monitored closely and that the environment is secured. Very important. You monitor closely, identification, BAMs. There are many things that could be used to identify these people. You know, they may have the tags, they may have a whole lot of things that someone seeing it would know. It's always on them. In case they wander out from the eyes of people, they will be able to, any other person will be able to easily spot them and be able to know their identity. It happens. It happens a whole lot. So what should Lois do? Like we said, maybe taking upon herself to ensure that that patient is monitored and the environment is secure. Takes me back to what one person asked, I think whether Genevieve or so, I'm not too sure, that how many people are in charge of these people. That's where it goes. In a situation where you have few people, then you have to do more of this work. In a place where you have many people, then you know that your job will not be too cumbersome because you have other people's eyes on this wandering, on the dementia patients, and the wandering could be arrested, if not by you, maybe the HCA, the healthcare assistants, or by any member of the healthcare team. You know, so it's important that Lois or NAs collaborate with their team to implement safety measures such as alarm systems, you know, so that when they move, it can, you know, the alarm system can be ignited and people will get to know something is wrong, or you can, you know that maybe there's something wrong somewhere. So all these things, all these practices are very, very important that we have talked so far. We cannot overemphasize it because of the nature of our job. Our job is very dicey. Risk is highly risky. It's not until you have to do with maybe rig job that you can fall into the ocean or anything that is risky. No, this one is risky, especially when you are doing it in strange terrains, whereby everything, you talk too much, it's abuse. You do like this, it could be turned against you. A whole lot of things happen. So it is better that to a large extent, we are able to know our onions. We are able to actually know what is expected of us and what we are there to do and what we should do. Nevertheless, you still have to have the on-the-job training because most of these facilities, especially in UK, in US, even if it's in UAE, that's United Arab Emirates, you've had people go there, you will have to be put through on-the-job training and you'll be trained again. Because with the certifications you have and everything, yes, they know you have the knowledge, but they will be more comfortable to put you through the training for you to be well-grounded and with align with the policies and how they go about their own, doing their own things. So this is very important. So those things, having said that, yeah, so I think that's the last for the evening. Health and safety regulations, very important. We have to ensure that we keep to what is expected of us. Safety of the patient, our own safety. It's not all about the patient's safety, your own safety too. While you are handling, while you are doing those things, think about yourself. Think about yourself too. The aftermath of you not having it right. You know, the transfers, the heavy relocating, the doing any work that is strenuous, and the stress also on you. So when you think about these things, you also look at ways that you can also ease up to avoid burnout, you know, to ease up tension, visit loved ones, see others, you know, talk to people you love. If you love nature, you can just take a break, go with your family, sit by the river or the ocean, you know, just sit there, or beach rather. You just sit there and look at how the waves of the water, you just feel happy because you need to cool off. before you start. But we all have different ways of cooling off anyway. So at this point, I don't know if we have any question. Do we have any contribution? We still have a little time left with us. I don't want to, because today we seem a bit tired. That vibes that we always have is not very much today, because I guess we are tired. But do we have any contributions or any questions? Are we together?
Yes, ma'am.
Yes, ma'am.
Yeah, we have come to the end.
Yes,
So
we
don't
are together.
those people that have fallen asleep on duty. We are talking about no sleeping on duty. Some people are already falling asleep on duty. So
I'm here
when
live.
so when
I'm
so
here.
yes, I know. I know. You know how this falling asleep is. It's not the main one that will sleep and maybe snore for those of us that snore. It's just the one that you tilt yourself small and you are listening to Dr. Mrs. Dorothy, and the sleep just comes. And now I said, are we sleeping? Are we together? You say, yes, we are together. That's the kind of one that is not sleeping. So please, let's not sleep on duty, because that's number one health and safety regulation for this training. So who has a question? Yes, Mildred, please. Mildred, go ahead.
Is on not sleeping on duty. What about if as a certified nursing assistant and maybe I'm on night duty and all my patients are sleeping? Won't I sleep?
Hey, who is asking that question? Mildred. Who is asking the question? Let me know. Let me know who the person is. So that when they call me that the person is sleeping on duty, they call BCC UK and they call me, I will remember. Mildred, the fact is this, when it is night shift, you are not supposed to sleep. What if as you sleep, something has happened? What if? Actually, I gave you an illustration of how my first child, this first child syndrome, how it used to be very sweet and all that. My first child, and that child actually came, there's a name we gave him in our dialect, which means has come to live, has come to stay, because all odds were against him as at that time. And me being first pregnancy, I didn't know anything. The people that knew were sleeping, as in sleeping. So what if something happened at that time? They were on night shift. Oh, these nurses, they were on night shift. What if something happens at the exact time they were sleeping? So if all the patients sleep, know that Mildred, is a very serious temptation. You have to start praying. That's when you should start praying, because it may be a temptation that, as everybody is sleeping, let me just lay my head and sleep a little.
But
then time you sleep, something happens. Yes. Go ahead. God forbid.
I have had, with my experience now, when my sister put to bed. That's yes. I think I've shared it before, but this portion will make you laugh, because like the nurses on night duty, I was the only active person. I was still with my sister. If I go to work, what they do, they will carry that what do you call it? What they used to move a sick person. What they used to wheel somebody, a stretcher. They will put it under the fan. Some will put it close to the AC. They'll be sleeping. If I go to wake them up, that a patient is calling, not even my sister, they will start for me. They will say, is she the first person that have had CS? What is it?
Oh, Jesus.
Is she the first person that have had CS? I say, somebody's baby is crying. Am I their nanny? Are you not your sister? So they don't have a sister. They don't have a sister to bring. Are you not the one helping your sister? Why can't they bring somebody to stay under the bed like you used to lie down? So that when your sister's baby cry, you cry. I had a lot of people. All of them, they will sleep until like 4:30 or 5 a.m. They sleep.
You are right.
That's why I asked whether somebody cannot sleep small.
Mildred, you are very correct. You are very correct. See, these things happen. That's why I can talk whenever I have health courses. I can talk. If nobody restricts me, I can talk and talk and talk, because I have seen it all. If you are not meant to be in the health field, please don't go and kill yourself or go and enter be behind bars because of the fact that you just want to get euros and dollars and all these things. The thing is in the heart, is in you knowing what you're supposed to do. I know we are not perfect, but when it is it's a mayhem, it's a syndrome, it's something that has eaten deep into the very fabrics of our healthcare sector. These things happen. And sometimes I weep whenever I go around and I see these things. I just wonder, I just ask myself, why do they venture into such field? Were they coerced into doing that? Were they forced into going? There are so many things, you know, anything goes. You can just walk anywhere. So that is true, Mildred. A whole lot of things happen. They sleep, especially in Nigeria, this side. But when you go out, I want you to ask yourself, even let's ask ourselves, maybe you have to maybe relocate. You know why I keep talking about Nigeria? Because God would help us. That's just the summary. God is only God that would help us. But when you go outside there, a lot of drama. You cannot even try it. Coming to see you sleeping on duty will automatically cost your job. If you are given the first warning, know that you are highly loved, especially if you are Black, you are from this part, and you are going to work maybe in places like UK and US. They love you so much, so you get the warning. But after the warning, you try it again. Of course, they show you the gates. And if they show you the gates, it's even better because you go out the gate and walk to your house. But if they don't show you the gates of the facility, rather they're showing you the gate of you know what that means. So we shouldn't try. That's why it's important that we do what we have to do. Sleep enough. In fact, if you know that you can sleep from morning till 1 hour to the time you want to go to the ship, you stand up, but don't go and sleep there. Don't follow the wrong things that are already happening, because if you continue to follow the wrong things that are happening, then 2 wrongs, of course, cannot make it right. So why do we want to correct the system after all? So it's important. Thank you, Mildred. You are always sharing very, very, I know you would have made a very good teacher. I don't know if you like the teaching profession, but maybe you can think about it. You would have made a good teacher if you decide to go there. Yeah. Mr. Alex first. I saw his hand raised. Mr. Alex Newben, I called earlier. You did not respond. Please, the floor is yours.
All right. Good evening once again.
Good evening, sir. How is Ghana?
Oh, Ghana is fine. Everything is fine.
All
In
right.
spite of the economic hardship, we are still managing.
Of course, God will
We are
help us.
talking about economic hardship in Ghana. What will Nigeria say?
What are you trying to say, Madam Augustina? What are you trying to say ironically? Okay, Mr. Newben, go ahead.
I know how you're feeling over there. I've been there on several occasions. I've been in Abuja on several occasions, so I know.
It's fine now.
All right. So, Madam Dorothy, God bless you once again. We are grateful.
Thank you. Bless you too.
I want to add a little contribution. You know, with us sleeping thin, I would say it's a syndrome associated with Africa or to Africa. It's a syndrome associated with
Alex, do you want them to crucify you on this platform? Go ahead.
No, because you know it's only common in Africa. You can't go out there and then sleep on duty. No, you can't. So it's good. It's good you are telling us or you are teaching us. So I would entreat each and every one of us to take whatever you are giving us or teaching us. It's good. Let's begin to learn it now. Even put it into practice.
Yeah.
God willing, we move out of our so-called Africa. This is our comfort zone. As my dear sister said earlier, it's true. If you're on duty in the night duty, what they do, the character or attitude we exhibit, it's an eyesore. They can drag the what's the name? The whatever under the fan and be sleeping. It's only in Africa that you see, let's say, quote and unquote, nurses, professional nurses with their earpiece in their ears, walking about. You see, I term them as gallivanting. They gallivant, and at the end of the month, their salary is assured. They know no matter what, they will be paid. So it's
anything goes. Yes, anything goes. Yeah.
After all, the job is not for their father, their mother. So it's only in Africa that we can see this. But out there, you dare not. You dare not. The structures are working. The systems are working.
Everything, yeah. So you don't have no dull moment. You cannot even attempt it. You will be seen, and then know how. So
you don't. So I think you are helping us, and then I really appreciate you for that. So my colleagues, I'm pleading with you. Let's just take everything serious, and then learn it. Let's even start with the practice before God.
People sleep in the house. Okay, Mr. Alex, thank you so much.
There's something I want to say.
It's nice. Okay, hold on, please. It's nice to have you, Mr. Alex, because you are just like you've been following us back to back on the health courses, and I'm glad to have you too today. Welcome.
Thank you, madam.
Right. So, who had someone wanted to say something? So say, Augustina.
Madam. Good
Augustina,
evening, madam.
please. Good evening. Good evening.
I want to share an experience on the ward during the night shift. And there is this nurse. Whenever we go for night duty, after let's say 10 p.m. medication, then this gentleman will go around and tell the patients. He will look at those in maybe a critical condition, but that they can talk, and then maybe they will be calling for help in the night. Then he will go around. Then he will say, "This place, when maybe you are in, you need a nurse in the night. The only thing you have to say is maybe a nurse Augustina, nurse Opari, maybe a nurse this." So he will go around and mention the other nurses' names to the patients.
Yes. Not his own name.
And then he will go and sleep. So at times, when after medication 10 and then let's say or 12, you want to lie down small. Normally, if we lie down close to the patient so that in case of anything, you can hear. Then we were doing it like 2 hours, but one person will be observing. 2 hours later, you will wake up and then this person will then observe. Then you hear, "Hey, Dr. Augustina, nurse Opari, nurse this." We don't know where the thing was coming from. So one day there was a patient who we brought from theater, and then this man went and then told a patient that this is what you can be saying on the ward when you need a nurse. Mom, I said we're looking for the nurse. We didn't find the nurse on the ward. Normally he will leave the ward and go and sleep somewhere. You will look for him, you will never get him. Then you'll be hearing your name from the patient's mouth when they in the night, doctor this, nurse this, in the night, and they're screaming, calling your name, and it's very bad. So later on, we got to know that he was the one who was doing that, and then we told him that no, if you want to sleep, sleep. If you are tired, tell us that you are tired and sleep, but don't be mentioning our names to the patient like that. It's not the best. Thank you, Mom.
Thank you, Augustina. Augustina, but I want to know, because you said you people used to arrange and take turns to sleep. This one will watch while this one sleeps. So I want to know, are you indirectly reporting yourself that you used to sleep on duty?
We are not. I'm not reporting, but it's something that we always do to. Take some small five. It's among us with the night staffs. That's
I'm just being funny. Don't worry. I understand.
Yes, well.
So someone is saying there's no motivation on the job. That's why the nurses sleep on duty and they work to put food on their tables and take care of their immediate needs. Of course, yeah, there's no motivation on the job, but the truth of the matter is your job is not like the bankers that if they are not motivated, they can leave the cash there and then go. Your own job it's a humanitarian work. Anybody in the health field, I tell them that you are doing a service to humanity. Once you know that one, take that one first. So if you are doing a service to humanity, then every other thing, yes, is important, but what is number one and paramount should be the welfare of the patient, because the patient is a human being. So it happens even in teaching. You see that the problem we have is so many teachers are not paid well and a whole lot of confusion. So they transfer the aggression to the children and a lot of things happen. But anytime I go around for seminars or I have to talk to them, I tell them something that these children are like things that are put in your hands. God puts them in your hands. And you are to nurture them and to take care of them, regardless of all odds. So when you have the passion and you have that at the back of your mind, regardless of how you are treated, to a large extent, because I know we are still humans, to a large extent, let that love and that number one call for duty overshadow the fact that you are being treated badly. So if that comes to you, you'll be able to. Yes, nurses are treated anyhow, but of course, it's human life. It's human life. Take, for instance, now banks can close, farmers can refuse to go to work. But when it comes to health, just a short time for us to have issues in the health sector, closed, nurses and doctors refusing to go to work. Can you count the number of casualties we'll have on ground? You cannot, because it's directly health, it's directly life, it's directly humanity. So that's one part that we should understand, though not easy, but when you condition your mind and you begin to learn how to do it, then you will move. Oh, Blessing Oche, this is a beautiful one. Don't forget, lives are involved. That's great. That's wonderful. Lives are involved. And so we should know that life is more important. Any other thing is secondary, but life is more important. So it's beautiful when you have been able to play a part in a person's life. You see the person smiling, you see the person getting better, you see the person, it just gives you that joy. So that being said, I don't know if we have another. Flourish. I didn't take your question or your contribution. Flourish.
My contribution is
okay. You contributed already.
As a new recruit into the nursing system, we want to do the job without sleeping, without just do the job because you have passion, you have love for it. But those you met there, we like you are doing high service.
Will kill the morale. Yeah.
They will say you are doing high service. Go and sleep. Why are you always doing like this? Why are you doing like that? And do you think it's your father's business? With that, your morals, everything you have learned will now go down. Very soon you start conforming to those people. That is why you see nurses sleeping. They are not supposed to. Yes, that was how it started. Not that they just recruit them. You employed me today, I will start sleeping today. No. It's what was going on that they had to. I've been to the hospital, I've worked in the hospital, but I find it amazing that you see nurses sleeping. But it was only one hospital. One day I went to, the MD came at night. All the nurses that night, he sacked all of them.
Yeah, that's what happened.
All of them sleeping.
Imagine people that are handling life.
You people are sleeping, and they gave you just 3 patients to wash over, and you are sleeping.
Imagine
just imagine. So majority of all these things is boiled down to, is like they will not pass it down.
Yeah, it's contagious.
Yeah, continuously. And you started it when you go there. They will say you are doing high service and you don't want to sleep, and you are doing this, you are doing that. Tomorrow, even those everything you brought, your vigorous power that you came there. They'll say go and win. I wish I was the one give you. Now your papa. That one keeps the morale of nurses. That is why you see some of them, not that they don't have the passion for it. It's just because they don't want their colleagues to stroke them, to shatter them. That is why most nurses, you see them sleeping. They will not even be sleeping. They'll just lie down and just be watching what is going
on. My dear.
Yes, just that in Nigeria, even Nigeria, Africa, they need to reform. Any nurse is going, they have to go and check their brain so that they will not sleep.
Flourish, please. I don't have any strength left in me to laugh. Please, please go and check their brain. Okay, maybe we would. BCC is good at doing that. Maybe we select some people on this platform. I will talk with I'll talk with Andy Smart. We need to select some people to top the list. Mildred will lead the team, and then Flourish will follow. Then we'll begin to move around and assess these facilities, check their brains. It's true, because that maybe if we do that, It will be better. We just have to think of how to do it. Thank you so much. If we want to talk about these anomalies as we progress, today we'll not leave this place because it's really, really alarming. It's really alarming. But I thank God for the people that keep moving through us. And I thank God that God so does it in such a way that he filters the people that he hands over to us for trainings. I don't know how, but it just happens. So already here, we are already focused. We already have this mindset. So it will go a long way in helping us in any way we find ourselves. Remember everything you've learned. I did to the natural laws of nature, the natural laws of nature. Do unto others what you would want others to do to you. And if that particular thing aligns with you, you will know that you will not be happy you will not be happy. Exchange yourself to be that patient. You will not be happy to see the nurses treat you like that. You will not be happy to see them sleeping when you need their help. You will not be happy, for them making fun of you when you actually reach out to them to assist one or two persons. And so if that natural law of nature follows us, we add it to the knowledge we have, I know that the sky will really be our stepping stone. It will be our stepping stone. So thank you so very much. I think with that, do we have any other contribution? I don't know if we have, but I saw some questions that time will not permit me to attend to, but I promise that tomorrow when we come, we'll attend to those questions. I've seen someone ask what the youth can do to reduce, not to have dementia. There are a lot of things that causes dementia, as a youthful person. So you have to guide against certain things so that your old age will not come with these things. Poor diet, you have to eat healthy, unhealthy fats, eating fats unhealthy, because these things can form cholesterol. They can even move to your brain and have blockage in your, a lot of things can happen and affect you in old age, So these things come with less inactivity. If you are someone that is low, you live a sedentary life, you don't do exercises, you don't do much activities, it will tell on you in your old age. Chronic stress, safeguard your stress level, watch your stress level. That takes us to tomorrow, to what we'll have tomorrow. Tomorrow, I crave your indulgence. Everybody, please, everybody should try to be around tomorrow. Health. I think it's just a few that have had that mental health training. Those that were in the CHCA certified healthcare assistant training that also here, a couple of you must have had that mental health training, which you can still have. It's like a refresher, to refresh your memory of what you learned. So it's important you are here, most especially for the CNA students. It is a certification that you would have, mental health awareness. And this is World Mental Health Month, October. So you need to be here so we can pull through and dissect everything we need. We would have time tomorrow, God willing, and we'll talk about mental health, how it can help us, because that's another very chronic, serious issue that we have today. So that being said, I wish to say a very big thank you to you before I hand over to Andy Smart Solutions. I want to say thank you to everybody that has stayed with me this far. I have seen the people that have stayed with me this far, and our class prefect has actually taken attendance, has done justice to taking attendance. The people that have stayed with us up until this end, I have seen them. Oh, Juliet, it's nice to have you. I know you must have been with us. Good evening, but I didn't take notice of it. I know you must have been with us since. So it's nice to have you. Gifts too. Ayokumi, I called you that time. You did not respond. I like to hear everybody's voices. You weren't able to hear me then, but I've heard your voice and I saw you put something on the chat box. So it's nice to have you. Adeswa, good evening. Taylor, everybody. Yes, please. Taylor.
For the assignments,
yes.
The last one I was unable to do it because I didn't have an idea about it. So if you give us this one, are we supposed to do both, or is just one? We should just pick one and do it.
No, you are supposed to pick one and do it. You're not to do both.
Okay, ma, thank you.
I don't want to stress anybody, I mean, I have to actually do what I preach. I don't want anybody to be under stress or duress. So you just pick one and do justice to it. That's all, Taylor.
Okay, ma. Thank you.
You're welcome. So that being said, thank you so very much. As I hand over to Andy Smart Solutions. Andy Smart.
Thank you, ma.
All right, Doctor, thank you so much. Thank you so much. As we have come to the end of today's class, our participants, you have been wonderful. I don't know whether, as our doctor, Mrs. Dorothy said, I don't know whether they selected you people. Very highly knowledgeable, excellent professionals in their fields. Really appreciate. Hear me?
We can hear him.
We can hear you.
We can hear you.
All right. And by the grace of God, God willing, anytime from now, one of our supervisors from BCC UK will be online also, and interact with you, ask you things, and talk with you as the course is going on. So let's be active as we used to do. Good night, everybody. Have a lovely night rest. We'll continue tomorrow.
Bye.
Bye. Bye.
Bye.
Good night.
Nice, thank you.
Doctor, congratulations.
Ah, me leave it.